Now we are in the opening session. The second agenda is singing Indonesia Raya song and March Unjaya. For all the webinar participants, please sit down straight, and for the participants in this room, please stand up straight. Ladies and gentlemen, please return to your seat. Ladies and gentlemen, the third agenda is welcoming speech. First, I would like to invite the head of the UNICARE committee, Nurse Ngatoyatu Rohmani, Master of Nursing Science. Dear Nurse Rohma, time is yours.
Thank you, Ms. Nilu. To our Honorable Rector, Universitas Jenderal Ahmad Yani, Yogyakarta, the Dean of Faculty of Health, Universitas Jenderal Ahmad Yani, Yogyakarta, the representative of Ministry of Health as a keynote speaker, our guest speakers from United States of America, United Kingdom, Indonesia, and Thailand, our lovely student and distinguished guests, ladies and gentlemen. Good morning. Assalamualaikum warahmatullahi wabarakatuh. First of all, let us praise to Allah for giving us His endless blessings so that we all can be here together in this special occasion in a perfect condition and health. It is an immense honor to welcome each of you to the first Unjaya International Conference of Healthcare. Today, we gather from across the globe, representing diverse culture, discipline, and perspective, united by a shared commitment to advancing knowledge and innovation related to healthcare resilience. The first Unjaya International Conference of Healthcare, held by Faculty of Health, Universitas Jenderal Ahmad Yani, Yogyakarta, in conjunction with the third Unjaya International Conference of Health Science, or UNIC, the first Unjaya International Conference on Practice and Innovative Complementary in Midwifery, or UNICOMIT, and also the first Unjaya International Conference on Pharmacy and Pharmaceutical Science, or UNICOPS. In an era defined by rapid change and unprecedented challenge, the importance of collaboration, knowledge exchange, and mutual understanding cannot be overstated. Each of us brings unique insight, expertise, and experience to this gathering, and together we hold the potential to create solutions that transcend borders and inspire progress on a global scale. This year's theme, Resilience Healthcare Society, reflects the urgency and complexity of the issues we face today. It reminds us of the importance of collaborations, especially in times of change and transformation. Although we may not be able to meet face-to-face, this online format enables us to connect in ways that are more inclusive and far-reaching than ever before. We have attendees from Indonesia, Netherlands, Taiwan, Nigeria, Kenya, and another country joining us, each bringing unique insight and perspective that make our discussion richer and more dynamic. Over the next few hours, we are privileged to hear from renowned speakers and experts to participate in discussion on developing resilient health system and to engage with one another in sessions designed to stimulate learning and innovation. I encourage each of you to take full advantage of this platform, join in the session, ask questions, participate in the chat, and network with peers. Your participation is what makes this conference truly come alive. I would like to express my heartfelt gratitude to everyone who made this event possible, our dedicated organizers, sponsors, and technical team who have worked tirelessly to ensure a seamless experience for all. Thank you for your hard work and dedication. And finally, thank you to each of you for being here today. Your presence, your energy, and your ideas are what make this event meaningful. Together, we have the power to inspire one another and to pave the way for future advancement in healthcare. Thank you. Wabillahi taufiq walhidayah. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Nurse Rohma, for your welcoming speech. Now, I would like to invite the Rector of Unjaya, Professor Dr. Renat Apotheker Triana Hertiani, Bachelor of Science, Magister of Science, to deliver the welcoming speech and officially open our agenda today. Dear Professor Triana, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Dear distinguished guests, speakers, colleagues, and students who's attending this conference offline and online, welcome to the first Unjaya International Conference of Healthcare. I'm thrilled to meet you all and acknowledge our honored keynote speakers from the Ministry of Health of the Republic of Indonesia, Dr. Ira Cyndira Tresna. And we also would like to honor our speakers with us today, Varsha Singh from the St. Joseph's University Medical Centers, New Jersey, USA, and Dr. Louis Hughes from Cardiff University, United Kingdom, and Assistant Professor Dr. Nitaya Pannam from Konkan University, Thailand, and Professor Intansari Nurjana from Universitas Gadjah Mada, and also Mrs. Apotheker Nikan Sati from Universitas Jenderal Ahmad Yani, Yogyakarta, which is here with us today. I would also like to warmly welcome representatives from various educational institutions who are joining us as webinar attendees. Our deepest gratitude goes to all of the sponsors who have supported this event, from PT Yakult, Terabit, Dana Dini, CV Kirana, Polyjustice, CV General Labora, CV Krishna Utama, PT Kairos Jaya Sejahtera, Pencipta Creative Communication, Obat Apps, and Unjaya Press. It is truly an honor to have each of you here as we gather to explore our theme, Resilience Healthcare Society. Today's event marks a significant step in our shared mission to build a robust and adaptable healthcare system which is fully in line with our journey toward achieving the Sustainable Development Goals. We are here to bridge essential gaps, especially in areas like digital health literacy and evidence-based practice. This conference is designed to empower healthcare professionals, educators, and students alike, enabling each of us to turn knowledge into meaningful impact. And beyond this, today is also about creating lasting partnership, transforming agreement into collaboration that will propel us forward. Our program today is filled with impactful discussion on vital topics, caring for a vulnerable population to the transformative power of digital health, to ensuring a resilient supply chain. We will also hold parallel sessions where presenters will share their latest research, offering deeper insights and encouraging collaboration within each specialty area. To all our speakers and participants, I want to extend a sincere thank you. Your commitment to this mission is invaluable. May today's conversation inspire us all, sparking new ideas and fresh approaches. And so, with a great excitement, I'm thrilled to officially declare the first Unjaya International Conference of Healthcare open by saying, Bismillahirrahmanirrahim. Thank you, and I wish you all a meaningful and enriching day ahead. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Professor Triana, for your welcoming speech. Ladies and gentlemen, I would like to invite Apotheker Salahuddin Al-Maduri, Magister of Clinical Pharmacy, to guide prayer. Dear Mr. Salahuddin, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Dear ladies and gentlemen, participants of the first Unjaya International Conference of Healthcare, on this happy occasion, allow me to lead the prayer. We hope that the activity for the next 2 days can run well. The prayer that I pray according with the guidance of Islam, for non-Muslim, please adjust. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Hamdan syakirin, hamdan na'imin, hamdan yuwafi ni'amahu wa yukafi'u mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalalikal karim wa 'azimi sultanik. Allahumma salli ala Muhammad wa ala ali Sayyidina Muhammad. Ya Allah, Ya Rahman, Ya Rahim, we thank you, we surrender and pray. Hopefully at the first Unjaya International Conference of Healthcare today, you will give fluency and blessing. Knowledge can be disseminated to the world community and apply to all health discipline. Ya Allah, Ya Rahman, Ya Rahim, give our presenter and all participants of the first Unjaya International Conference of Healthcare, you give health, peaceful, gratitude, and happiness, so that with this forum, many benefits are obtained, friendship, knowledge sharing, new friends, and knowledge that is full of blessing. Rabbi zidni ilma warzuqni fahma waj'alni minas solihin. ربنا تقبل منا إنك أنت السميع العليم وتب علينا إنك أنت التواب الرحيم ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. May Allah blessing us. Amin. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Salahuddin, for guide us pray. Ladies and gentlemen, I would like to invite all the participants in this Zoom meeting to open your camera and please using the virtual background because right now we are in the photo session. To the committee in charge, please guide and take the picture. We will take the picture from the first slide. The second slide. The third slide. The fourth slide. The fifth slide. The sixth slide. The seventh slide. The eighth slide. The ninth slide. The 10th slide. Ladies and gentlemen, now we have come to our main agenda, the webinar session. The presentation and discussion will be moderated by our moderator, Nurse Masta Huta Soid, Magister of Nursing Science. Ladies and gentlemen, allow me to read her short bio. Mrs. Masta is a lecturer of Nursing Department of Unjaya. She graduated her master's degree from Gajah Mada University, Indonesia. She actively as a pediatric nurse and currently pursues her PhD in Lincoln University, Malaysia. Ladies and gentlemen, please welcome our moderator, Mrs. Masta Huta Soid.
Thank you, Ms. Rosita, for introducing me. Hello, everyone. Good morning, ladies and gentlemen. Welcome to the first Unjaya International Conference of Health Science. I'm Masta Huta Soid. It's an honor for me to be here as a moderator in this morning session. The first Unjaya International Conference of the Faculty of the Healthcare held by Faculty of Health, Universitas Jenderal Ahmad Yani, Yogyakarta. This is the yearly event that consists of 3 programs. The number 1 is the third Unjaya International Conference of Health Science, UNICARE, from the nursing program. The second one, the first Unjaya International Conference of Practical and Innovative Complementary in Midwifery, UNICOMID, from Midwifery program. And the last one, the first Unjaya International Conference on Pharmacy and Pharmaceutical Science, UNICOPS, from Pharmacy programs. There are various backgrounds from our participant today, from nursing, pharmacy, and midwifery, who come not only from Indonesia, but also from Taiwan, the Netherlands, the United States, Kenya, Nigeria, and many more. As mentioned by the Master of Ceremony, for the morning part, we have 3 speakers who are expert in their area. They are Varsha Singh from St. Joseph University Medical Center, New Jersey, USA. Professor Intansari Nurjana from Gajah Mada University, and also Dr. Ira Cyndira Tresna from the Indonesian Ministry of Health. Each speaker will have 30 minutes to present their topic, followed by a discussion session for the next 15 minutes. We hope that you can take the chance to find out more about the material. For all the participants who have questions for the speaker, you can ask them directly by raising your hand using the emoticon in Zoom. Or you can also write your question in the chat room, and I'm going to read them for you. All right, we can go to the first speaker. Our first speaker is Varsha Singh, TNP, ANPC, NEE, BC, SCRN, FAHA, who will talk about innovative approach enhancing nursing competency through mentorship, skills testing, and continuing education. Hello, Varsha. How are you?
I'm very good, thank you. Can you hear me?
Yes, I hear you clearly. Can you hear me?
Yes, absolutely. Wonderful.
Thank you, Varsha. It is such a pleasure for me to meet you again virtually. For your information, this is the second time Dr. Varsha joined with us in the Unjaya International Conference. Thank you to spare time to share your knowledge today.
It's my pleasure.
Thank you, Varsha. Now I will read Varsha Singh's curriculum vitae. Dr. Varsha graduated from Seton Hall University in 2009 for her master's degree and her doctoral degree in 2018 from Seton Hall University also. Dr. Varsha Singh has a lot of professional experience. She is a neuroscience nurse practitioner or stroke program manager at St. Joseph University Medical Center in New Jersey, the United States. She also worked in the faculty Fairleigh Dickinson University as a part-time professor of nursing course from 2022 until now. She is a researcher in neuroscience and has received many awards. She got a lot of awards from 2014 until 2024. And the last award, she got a winner, Excellent in Advanced Practice Nursing Leadership in 2024. Dr. Varsha is a doctoral prepared healthcare nurse executive who has more than 14 years of experience in this niche area of stroke program management and is certified as a telehealth clinical provider. Okay, Dr. Varsha, time is yours.
Thank you so much, and I appreciate this second invitation to your first Unjaya University Combined Health Conference. I'm going to share my PowerPoint presentation, and I will be speaking in English. So I hope everyone can understand English in this room, I believe. So even before I share my presentation today, I want to share something very important with everyone who is sitting in this room. Number one, it's an honor and a pleasure to be in presence of all of you because you all are very special. We nurses are gifted to care for another human being with our five senses. We provide them not just the nursing care, but compassion and compassionate care that is based on how we empower ourselves with skills and knowledge and bring all that knowledge together so that we continue to hone our skill and experience to be better and better every day. So let me start with sharing my PowerPoint with you. And I hope everyone can see this. Give me 1 second.
Injit. Oh, mereka yang susun renungan tuh kalau yang mereka yang itu.
So today I'm presenting on innovative approach and enhancing our nursing competency through mentorship, skills testing, and continuing education. So today, first I have to say that I have to declare it's a continuing education. I have nothing to disclose, which means I have no financial relationship, and everything that I'm going to share is based on evidence-based practice. So what is the objective today? Once I complete my presentation, what are you all going to learn? Number one, you will understand the key concepts. What is a nursing competency? What are those innovative approaches? We must stay competent all the time. We must stay in pace with the advanced technology, new knowledge, new evidence-based practice, research. And then I am also going to throw light on what is the role of mentorship. Why do we need mentor? Why skill testing is so important so that we can be competent every time. And what is the importance of continuing education, the way we shape our career as a nurse educator, as a nurse faculty, as a resource nurse, as a supervisor, and going further as a leader nurse. So first, I want to talk about how we are governed as far as our education and practice is concerned. For all the new nurses and the fresh graduates, it's really important to understand that what we learn in our nursing school, when we are graduating, when we are doing our clinical, when we are learning through our books, theoretical and practicum, all that knowledge that we gain, then we finally apply all our knowledge towards our nursing board examination. That's when we want to get licensed. But when we come into actual practice as a nurse with our board license and our diploma, it is not just enough to bring that knowledge that we have gained from school to the actual nursing role. There are many other bodies that govern our practice. So the National Nursing Organization, wherever you are practicing, whichever country you are practicing, whether it is United States, whether it is United Kingdom, whether it is Ireland, Netherlands, or Indonesia, every nation has a national nursing organization, and they develop all the guidelines, clinical guidelines, scope of practice for nurses, and we all abide by those nursing guidelines. other than the National Nursing Organization. For example, United States has American Nursing Association, ANA, and they roll out a lot of policies and procedures, scope of practice, white papers. Other than the national, then there are regulatory bodies such as the Joint Commission or DNV. And these regulatory agencies define the minimal standards for the regulation or practice, which is to protect the patient. Then there is a state-wise, depending on the country, there are state-based or region-based board of nursing. And then finally, there are specialty certification boards, which will define that if a nurse wants to practice in neurology, then they must have neurology certification. If a nurse wants to specialize in nephrology, then they must have nephrology certification. So similarly, there are cardiology, orthopedic, occupational health. There are different specialty certification that defines what a nurse needs to know and how a nurse should be skilled in order to practice in that area. And then finally, it comes to the employer, which means the clinic or the hospital or the regional hospital where we are working. The employer is responsible and accountable to provide a very conducive environment to the nurses so that they are competent when they are practicing in that hospital or clinic. So employer has to provide a very good orientation, not just about the clinicals, but also about how is our organization laid out, what are the departments, how is the structure. There is a chief nursing officer, then there are directors, then the managers, the floor supervisors, unit supervisors, and what special skills training are required in critical care or medical surgical or neurology. And finally, the employer's responsibility is also to conduct an annual mandatory education for the nurses. And all this combined together supports the nursing practice. So nurses have a lot of resources and a lot of guidelines to follow to make sure finally that the patient who comes to the organization receives absolutely competent and quality care. So competency standards for international nursing professionals, it's the graduation achievement goals as they relate to enhancing the development of nursing competency. This is based on the Conference for Nursing Education model. Then there are international competency standards framework for general nurses, which comes from International Council of Nurses. And then finally, the scope and standards of nursing practice, where in United States, we follow as per the National Nursing Organization, and here it is American Nurses Association. So just I wanted to share about ANA's Code of Ethics for nurses with interpretive statements. So when we talk about individual nurses, I as a nurse, what is my responsibility? So I as a nurse, I am accountable for assessing my own competence. So ethically, I would say, do I know how to insert an IV appropriately? Am I confident? Am I competent? Right? So it is my accountability. It's my responsibility before I start doing that procedure. And maintenance of competence, that means I practice, and someone, my peer or my boss or an educator verifies that I am competent. Ongoing professional growth involves the control of one's own conduct in a way that is primarily self-regarding. So that is acting responsible, being accountable for our own practice. And that's how nurses are the most trusted professional across the globe, because we are very responsible and very accountable for our own accord. So what is competence? Competence affects one's self-respect, self-esteem, professional status, and the meaningfulness of the work. When we learn a skill, when we practice, and when we see how our competence makes a patient get better faster, that gives us a sense of self-respect and self-esteem. In all nursing roles, evaluation of one's own performance coupled with peer review, that means always checking with our peers, our colleagues, is a means by which the nursing practice can be held to the highest standards. And the nurse owes the same duties to self and to others to maintain competence. So let's talk about a little bit about competence and competency. Competence is performing successfully at an expected level, which means whatever you learned, you should be able to reproduce. It's an expected level of performance that integrates knowledge, skills, abilities, and judgment. The integration of knowledge, skills, abilities, and judgment occurs in the formal, informal, and reflective learning. And I have some slides to explain you that. So the core competency of nursing is the ability to practice nursing that meets the needs of the client cared for using logical thinking and accurate nursing skills. So we understand patient needs, we have ability to provide care, we have ability to collaborate and also support the decision making. Let's talk about knowledge. Knowledge encompasses thinking, understanding of science, humanities, professional standard of practice, and insights gained from practical experiences when we are in school doing our clinical, personal capabilities, and leadership performance. So knowledge is acquired through comprehensive learning. So think about everything that you are doing in your nursing program, such as biology, chemistry, microbiome, mathematics. It creates a foundation for your knowledge, and then you go to actual nursing classes, nursing programs, which teach you about the nursing practice, scopes, standards, interventions, and skills. So you have theoretical and then practicum combined together. It gives you a lot of knowledge that you accumulate, and then you add skills to that. Now, what are skills? These are psychomotor, communication, interpersonal, and diagnostic. Everything put together. What you can see with your eyes, hear with your ears, do with your hands, right? Injections, head to toe assessments, IV insertion, infusion pump management, computer skills, and equipment operations. These are all the skills. And as if you are specializing in surgery, then there are a lot more psychomotor skills such as wound care or stitching, or it can be insertion of a PEG tube. All those skills combined enhances our own nursing practice. Then comes ability. When we accumulate knowledge, when we learn all the skills, then it is our capacity. We should be able to reproduce. That means we should have the capacity to act effectively. And that requires listening, paying attention, integrity, and knowledge of one's strength and weaknesses. Be honest that I still need to practice. Be honest that I need to practice 10 more times to become good at that skill. Positive self-regard, emotional intelligence, and openness for the feedback. So always be open with your faculty. If you need more practice, if you're not sure about any skill, be honest so that next time when you are going to provide care to your patient, you will be providing the best quality care once you develop that ability. Find correct resources, ability to recognize a medication error and proactively prevent it. So when we practice, when we learn, we practice our skill, we develop our ability to resolve. A nurse's ability to resolve patient anxiety through appropriate, compassionate communication. Then comes the judgment. When you combine knowledge, skills, and ability, then you become critical thinker, you become a problem solver, ethical reasoning, and decision making, such as your nursing care plan. your care plan as per the patient's most current priority. Assess vitals and make a judgment that I must call the doctor right now because now I can interpret the vitals. You review the lab values and you make a judgment that patient is improving or the patient requires further intervention. The nurse makes a judgment if there is a need for the consultation with an experienced nurse. I need to talk to my supervisor. I need to talk to my boss. I need to talk to an educator. So that is your judgment. And then formal learning, which is continuing education. We never stop learning. Remember this, please write it down somewhere that we are all, including me, we are lifelong learner because medicine, nursing, advanced technology combined together is an evolving science. It is not stagnant. If we think about treatments and nursing cares 15 years ago, and if we think about it now, there is a huge difference. So all this formal learning can happen during new hire, continuing skill lab, skills refresh, advanced degree education, advanced nurse practitioner degree education, clinical enhancement through peer-to-peer training, and performance improvement through research project. And reflective learning represents the recurrent thoughtful personal self-assessment. Can I do this? Or do I need to learn more? Self-assessment through annual evaluation, strengths and weaknesses. And then reflective learning is asking yourself a question. Do I need a mentor? Find a mentor. Connect with someone who can guide you. Creating goals and future vision board for individual nurse. And having a nurse fellowship program within the organization to empower fresh new graduates, orient them a little bit more, find a mentor, one-to-one mentor and mentee, and then succession planning. A very experienced nurse can say, I see my future in you. I'm going to be your mentor. I will teach you everything that I know so that we both can grow together. So let's look at Benner's theory and nursing competency. We all go through this stage. I was a novice nurse one day, and I don't call myself the expert, but yes, I'm somewhere between proficient and expert, and I'm ready to share my knowledge with anyone who is willing to learn from me. So what is a novice nurse as per Benner's theory? It's a new hire graduate who has come out of school, very anxious. How am I going to perform in real world, right? When you start from your nursing school and when you are starting the first job, they may not have the confidence. They may lack confidence to demonstrate safe practice and requires continuing verbal and physical cues. Typically, these nurses require an orientation under strict supervision. The supervisor or the mentor or someone who is orienting this nurse should be always be guiding this nurse. Advanced beginner who has been in the works for 2-3 years, they have learned, they are a little bit confident, but this is a great opportunity for skill testing. They need to refresh their skills as well as they need to have continuing education to strengthen the skill, knowledge, and organization-based policy. As the knowledge is developing, the advanced beginner must also decide the transition from the generalized care to a specialized care. 2-3 years on a general care is a great time period. Now they can say, I want to specialize in nephro or cardiology or neurology or operating room. This is the time they should find a mentor to specialize in that care area. A competent nurse is a very confident nurse, more than 2 years, efficiency, coordination, confidence in the actions. They can do nursing care plan based on the considerable conscious, abstract, and analytical, and they can find a problem solution with their skills quickly. Their care is completed within the expected time frame without any support from anyone. I can do it by myself. Thank you, but I have learned. I'm skillful. I have taken a lot of continuing education class and skill, and this allows the registered nurse to practice safely and effectively in a very specific role. A proficient nurse is applicable to the nurses who are in work for more than 3 years, and because they have practiced their skills in their area for a longer time, they can see their patient situation very holistically and very clearly. They know that if my patient has this issue, I know what I'm going to do. The proficient nurse can understand the care, and they have a holistic understanding that improves the proficient nurse's decision making. They are less ambiguous, they are not skeptical, they don't hesitate, they are experienced enough to do their nursing care very quickly. And finally, the expert nurse. They have expertise in the skills, knowledge, managing the situation, and they also have intuitive grasp of each situation, and they can provide solution without weighing different options. They are very quick to act. They have critical thinking. They can see the whole situation in a quick time, and their actions are carried out with extreme ease and proficiency. They are not nervous, they don't have anxiety, they have a lot of confidence, and it comes with, again, continuing education, skill testing, and enhancement of knowledge through attending conferences, presenting at conference, or conducting an education session for their new nurses. So after I have talked about the Benner's theory of novice to expert, the fresh graduates are in the novice stage and they require a lot of support through continuing education, which means attending a conference like this, a health conference like this, which provides a lot of knowledge and a lot of um, opportunity to interact and ask questions. Now, based on what we have talked about the competency, there are 13 key qualities that can enhance competency of any nurse. Either it can be you or me or anyone who is on any spectrum of beginners, novice to expert. Resourcefulness. Where are the things? Where are the supplies? Where do I find things? So that resourcefulness is a unique quality every nurse should have. You know, sometimes it's really fun activity if a nursing school can organize, or even a new employer can organize what is known as a treasure hunt. Give a map, give them a question where to find and what will you do. And this kind of very innovative skills can give a lot of confidence to the nurses within the organization. Creative problem solving. So having a workshop of case studies and ask them to have a creative problem solving session. Intuition, having a kind of sense of intuition that I know what I can do in this critical condition. Confidence is very important. When you have gone to nursing school, when you have spent years in learning new knowledge, that confidence is generated only when you practice and practice and practice. Self-discipline, timeliness, good assessment abilities, communication, being gentle, compassionate, caring. These are our qualities, which is reflected in our communication, which instantly alleviates pain or uncomfortable status of a patient or anyone around you. Work and life balance is an important part of our life because we are human beings as well. So we do not bring work to home and we do not bring home to work. We keep a fine balance. Self-care, we must take care of ourselves so that we have energy and we have that thought process that I'm here for my patient, but I'm also here for me. When we do great self-care for ourselves, we have all the energy to care for our patient. Time management, resilience. Resilience is adapting to any situation and not becoming too much anxious that what is going to happen. Becoming resilient also gives us an opportunity to be more adaptable to the situation. And endurance comes that once you do one skill successfully, You provide care to patient day after day after day. You become an expert, skillful nurse who can endure everything. I have met nurses who are not afraid of any situation. They will say, I can do anything. I can do anything. Give me any patient, I will be able to take care of that. So, an innovative approach to sustain a culture of safety through competency. When we are competent, we keep our patients safe. We help them recover faster. So, education that focuses on knowledge, skills, ability, and competency, a well planned orientation, peer rounding and mentoring for first 2 years, skill enhancement during first 2 years, structured and regular ability and competency check. It's really good idea to check like, hey, do I need to refresh my skills? I forgot how to do it. I had done it 2 years ago. Maybe I need a refresher. Maybe there is a new technology. There is a new equipment. There are new devices. So I need to go to the skill lab and practice. Nursing participation in grand rounds with medical staff is a very good idea to develop your skill. Introductory 6 months and annual evaluation will help not only the organization, hospitals, but also the nurses. And mandatory continuing education, including in services for the equipment and devices. We know that the technology is developing so fast. One day you are using one equipment, and suddenly there is a new equipment with some artificial intelligence incorporated in that. And now nurses need to know how to use it. So, regular in service is a very good idea. So I just wanted to share, this is a very busy slide, but there is a nursing CEO who developed this model, and I thought I would share it with you. I will not read the whole slide, but I would say these 6 key elements are care, compassion, courage, communication, commitment, and competence. If we adopt these 6 C's in our practice, then we will become the most competent nurse for life. So I wanted to share this case study, and this is a very special case study because it's a qualitative study which was done in Indonesia. So they did one study about competency, described nurses' experiences maintaining competencies and getting continuing education as part of their career ladder implementation in hospital. This was a qualitative phenomenology to acknowledge the participants' subjective experience. How am I competent? How do I define competency? And allow insights into how individual nurses understood and constructed their lives. So they used continuing professional development as part of their ladder system related to maintaining nursing competencies. And what they found, there were 4 themes. That one was continuing professional development, credentialing by a career ladder system, and missed care still occurs in the implementation of nursing services. And 4, nurses have hopes that the managers support efforts to maintain competence through CPD. So, what I learned from the case study is that it is a win-win situation when the organization creates a relationship that is based on mutual trust and mutual support. For a new nurse, it is the nurse manager, or it can be also the nursing peers who are on the floor, who are working with them. So, based on what I talked about, how we all can focus on number one, mentorship, having someone around us who can believe in us, or who can guide us, continuing skill testing, and continuing education. This can keep us competent nurse, which is the requirement as a nurse on the floor when we are providing care to our patients. So when we are talking about competency, there is a wonderful award that is given. Every organization can apply for this award through under ANA Magnet. A Daisy Nurse Leader Award for the Extraordinary Nurses is an international recognition program which was started in memory of J. Patrick Barnes. The family created the Daisy Nurse Leader Award for Extraordinary Nurses to express gratitude to nurses and to enable their patients, families, and staff to thank and honor their special nurses. So, whenever a Daisy Award is given, this is the most prestigious clinical leadership recognition and is awarded annually. So, everyone who is striving to a nurse who wants to set an extraordinary example towards patient care has an opportunity to become a Daisy nurse. So, finally, the safe and effective nursing practice has this circle of what you can see is competency, integration of knowledge, skills, judgment, formal learning, reflective learning, and ability. So, the way to get started as a competent nurse, as we all agree, that enough of talking and let's start doing what we all do as a nurse is provide a quality and competent care. These are my references, and I want to thank you all for listening to me. And my message to all of you is that each one of you can make limitless contribution to the healthcare system if you have a desire to soar high in the sky. So spread your wings, fly high, always be confident, have that belief in yourself that I am able to do it. And remember that the sky is not limit for us. We can go beyond the sky and we can set our own limit because there is actually no limit to what we can do. Thank you. I wanted to know if there are any questions.
Yes. Okay, thank you, Dr. Varsha, for giving such an informative and comprehensive presentation. I do agree with you, Dr. Varsha, that we face so many challenges to improve the competence of nurses from novice to expert, especially through education. I will make a short conclusion from your presentation today that competence is performing successfully at an expected level that integrated knowledge, skills, ability, and judgment. Now we will have discussion session. Is there any participant in Zoom who want to ask the question to Dr. Varsha? For participants who want to ask question to Dr. Varsha, you can raise your hand and the committee will help to unmute so you can ask your question. Or you can also write your question in the chat box or chat room.
I'm going to check the chat box if there is any question.
Okay. Please, the committee, bring the question to screen. There is a question.
Okay, I think there is a question. It says, how can objective structured clinical exams be utilized to assess and enhance nursing competency in the US? So I believe the question is that when we are doing didactic exam questions or the clinical exam questions, how does it build and enhance nursing competency in US? So Even before, I would answer it like this, that even before a question is presented to the student is actually given enough theoretical knowledge, and then we have what is known as simulation labs. So the students technically, if they cannot go to real patient, the simulation lab has an ability where they can play out the whole scenario, and the simulation labs have been really beneficial in eliminating the anxiety the new students can have, that, oh my God, I am touching a real patient and how the patient will react. So all those anxiety or stressful elements of the clinical aspect is eliminated, because in simulation area, the student feels really safe and they can practice their skills. So didactic combined with that clinical skill will prepare them when they are asked a question, right? So let me give you an example. Say, for example, a case study is given in a simulation environment, and the student is actually in that situation where the question is, if the patient is not answering your question when you ask them, how are you? The patient is just looking at them without answering question. What is your judgment? So is patient cognitively declined, or is patient unconscious, or is patient experiencing hypoglycemia, or is patient experiencing hypothermia? Now, if you are given these 4 choices, based on your didactic knowledge, you will say, number 1, if the patient cannot understand my question, I will have to check whether the patient can hear me well. That is number 1. So you will do a whisper test, and then you will also check the glucose, and then you will also check the temperature and the oxygen level. So these are all the nursing skills that you are taught to do to check the level of consciousness. So that clinical exam is developed based on the didactic and clinical, so that a nursing student will be taught first and then tested whether they can demonstrate it back. I hope I answered your question.
Okay, thank you, Varsha, for answer the question. But we have one more question in the chat room. I will read them for you. The question comes from Maharani. What strategies can be employed to ensure that ongoing competency development efforts are culturally competent and inclusive of diverse patient population?
Oh, that is such a wonderful question.
Yes.
Because in culturally competent education and inclusive of diverse patient population is not just pertinent to one country now. We all have global patient population. So every nursing school, they must have a course, and I would say it's essential now, because we have patients who speak different languages, they come from different ethnicity, they come from different religious group. So it's really important that the nursing school include not only a didactic course where acculturation or the transcultural nursing is discussed in detail. Every nursing student has at least some perspective of learning about different cultures, ethnicity, and religion, their practices, not only just the religious and cultural practices, but also what food they eat, how they live their life, what are their health beliefs, right? Every culture has a different set of health beliefs. So it's very important to have not only a didactic class, but also a class where the nursing students can go out in the community, and then they can explore by interviewing a diverse patient, not from their own culture, from a different, diverse cultural origin. This is the only way we will be able to prepare our nursing student for the future. because it's not just, if I talk about myself, I'm from India, but I'm meeting anyone and everyone in United States. They can be from Mexico, they can be from UK, they can be from Indonesia, Philippines. We have amalgam of cultures in USA. But in spite of having so many cultures and religions and ethnicity in one place, the nursing will stand out, because what is the center of nursing care is being respectful for each and every culture, and at any point no one can have 100% knowledge of all the cultures and all the ethnicity. At that point, as an honest nurse, we can always say that, let me find out, because there is always a resource that we can reach and ask a question. Did I answer your question, Maharani?
Thank you, Varsha. Okay, we next to the third question. The third question comes from Rizkiana Andika. Dr. Varsha, I have a question. The question is, how does a mentorship relationship contribute to building critical thinking skills in nursing, in nurse? Please, Dr. Varsha.
Thank you for asking that question, Rizkiana. I have mentored so many students, and I'm almost thinking of all those incidences, episodes where I had my mentee with me, and I like to push them. And my best question that I ask, a mentor can ask a question. I like to make my students think. So, a mentorship relationship contributing to building critical thinking skill is same as, think about someone who is taking swimming lesson, right? A person who has not been in the water for the first time will always be scared. So the mentor will say, I am going to give you a jacket or a floating device, but I will be right next to you, but I will teach you how to swim. So a mentor will instill critical thinking skill in the mentee by putting them in a situation and asking a question. Tell me, why are you doing this? The mentor has all the right questions. And I will give you an example. If a nursing student is just put to care for a patient, say interviewing a patient or assessing the lung sounds or inserting an IV, if that nursing student or a new nurse is alone in that room, and whatever skill practice or whatever care that nurse will be doing it at that time will be very different than the mentor standing right next to and saying, don't worry, I'm right next to you. Let's start the assessment. Let's start the nursing care. But tell me why you are assessing the lung sound. Tell me why you are checking the oxygen. Tell me why you are checking the blood glucose. Every question that is asked by a mentee, it kind of puts the mentee in a thinking process. And once you start thinking, and when you start doing your intervention, experiences after experiences and questions after questions, this relationship will create a great thinking, critical thinking in that nurse, which is very essential. Rather than working all by themselves or alone, this support and questioning and corrections at the same time, that, okay, wait a minute, let me show you how. And while they are answering, the mentor can say, perfect, that's a great answer, but let me tell you one more thing. So this is known as building of skills and building of knowledge and building of critical thinking skills alongside with a mentor who confirms that, yes, I'm doing right, or maybe I'm not doing it right, I need to improve on my skills. So that is how the mentorship is very crucial to develop critical thinking skills. Did I answer your question, Rizkiana?
Thank you, Varsha, for answer the clearly with explanation. Yeah. We are glad to receive so many questions in the chat room, but due the limitation of time, we read the more one question. The fourth question from Meva Nabila. What role do nurse leaders play in fostering a culture of continuous learning and competency enhancement within a healthcare organization? Please, Varsha.
Thank you, thank you. So, I would say Meva, Nabila. I would say that having a nurse leader who is committed and invested in all the nurses in that organization is a blessing, because the nurse leaders can be an instrumental force of a change. They not only can foster a culture of continuing learning through their innovative approach, their policies, how they create policies that all my nurses must have a specialty certification. Not only they put those policies in place, but they also bring in funding, support, leadership support, recognition. And one of these greatest example of this kind of nursing leadership is the nurse leaders who strive to get designations such as magnet for the organization. Under the umbrella of magnet, all the nurses must do research. Nurses are encouraged to get specialty certification. Nurses are encouraged to go to conferences and present. Nurses are encouraged to do research. And this nurse leader, who can be a chief nurse officer or she can be a nurse scientist, this nurse leader ensures that they will write proposal and grants and get the funding for these nurses who are going to pursue the certification. I would give you example of what I can do within my organization. Being working for a magnet organization, I have an opportunity to provide free specialty certification to all my nurses, and I have funding, so I provide them free books, and then I also can give them the exam fees so that they all can get certified as a stroke special certified national stroke certified nurse, which is through American Association of Neurology Nurses. And as a nurse leader, I am fortunate that I was able to secure a grant funding for them. So to date, in last 5 years, I have been able to get at least 35 nurses get that certification, which has been a great achievement. And it looks really great for magnet certification. So this is an example of nurse leader who can really work hard for all the nurses and create a culture of competency. Because competency is again through continuing education, skills testing, and always looking forward to get an advanced degree. And nurse leaders who are visionary and have futuristic vision can change the entire world for the organization through their leadership skills.
Thank you, Varsha, for your answer. Because we have a limitation of time, this is the end of the discussion session. Okay, thank you very much, Dr. Varsha. Okay, before we move to
I just want to say a big thank you to everyone, and I hope to see you all be very successful in your career, and maybe next time I will listen to you presenting here on this forum. So good luck to all of you. Thank you.
Okay, thank you all. We would be happy if you still with us until the end of this session. But Dr. Varsha, if you have another activity, feel free to leave the Zoom. And maybe the next conference we will invite you again to give the knowledge and to sharing your paper. Thank you, Dr. Varsha.
Thank you.
Giving applause to our speaker, Dr. Varsha. Before we going to the second speaker, the committee will share the poster from presenter and followed by a presentation from PT Kairos as a sponsor. Thank you.
Good morning, everyone. Thank you for taking the time to visit our unique presentation. Today, I'm excited to share with you about the finding of the authors that they done before, and I want to all of you to see the result. Okay, let's start with poster number 1. With the author are Afi Lutfiati, Master Hotosoid, and Novita Nirmalasari. The title is Determinant of the Factor Related to Menstrual Syndrome at Guardians 1 Senior High School at Sleman District. And the objective of the research is to determine the association between menarche, menstrual cycle, stress, sleep quality, body mass index with the incidence of premenstrual syndrome. And the conclusion is multivariate tests with logistic regression for that the most dominant factor associated with the incidence of premenstrual syndrome were sleep quality. Okay, we move to the second poster. The author are Astri Nursharifah Duyati. The title is The Effect of Cinnamon Aromatherapy, the cinnamon burmani, on decreasing dysmenorrhea in Fort Camping Junior High School. The objective of this research are to determine the effect of the cinnamon's aromatherapy on reducing dysmenorrhea in female students of Fort Camping Junior High School. And the conclusion is based on the results of the Wilcoxon test. It's great students who get cinnamon aromatherapy experience a decrease in dysmenorrhea pain scale with the p-value of 0.01. 0.001. The value of the pain scale before and after intervention show that the administration of the cinnamon aromatherapy can help female students of Fort Camping Junior High School in reducing the dysmenorrhea scale. Okay, we move to the third poster by Abdul Latif. The title is the relationship between effort of prevent bullying behavior and the level of children confidence in Sleman. And the conclusion, there is an important relationship between effort to prevent bullying behavior and the level of confidence of the children in Sleman Elementary School, with the p-value 0.000 with the correlation coefficient value or R of 0.609 with the strong relationship level and a positive relationship direction. There's the direction of the relationship between the two variables. Identify that the better the effort to prevent bullying behavior, the better of the level children's confidence in Sleman Elementary School. The next poster was by Lili Sri Sriwiyati, Putu Juni Andika, Tri Yahya Christina Safarudin, and Istiqomah, with the title On Care of Life in the Emergency Department. And there is two models of the trajectories which they define as spectacular, acute, sudden, resulting in traumatic loss of life, will always involve resuscitation measures, and spectacular, quite expected death, often in those who have been ill for a long time, not the priority for staff. Patients who experience spectacular death are not considered dying, and there are many actions required to deal with his death. The next is research by Dwi Kartika Rukmi, Juk Warsi, and Anto. I'm sorry if my pronunciation is not good enough. With the title is Knowledge Regarding HIV Pre-Exposure Prophylaxis or PrEP and Associated Factors Among Men Who Have Sex with Men, MSM, in Yogyakarta, Indonesia. And the recommendation for this research is the average level of knowledge related to PrEP among MSM in Yogyakarta, Indonesia is still within the moderate category and has the most significant relationship with sexual orientation. Therefore, there is a need to increase information and more comprehensive education related to PrEP to MSM by paying more attention to their sexual orientation. And the next of research, there's by Profi Kotul Makia, with the title is Overview of the Nutritional Status of Tutor in the Palian Gunung Kidul Yogyakarta Health Center. The objective of this research is to find out an overview of the nutritional status of tutor at the Palian Gunung Kidul Health Center, Yogyakarta. And the result is the research results showed that the nutritional status of the tutor was good, and the nutritional status of the tutor based on the gender category, mostly male, and there was 21.6%. The children are 24 until 36 months, and they have 2.7 until 9.6 kilograms, and most of the mother are non-working mother. The conclusion is the nutritional status of the tutor are good. Okay, the next one, the research by Laili Nur Hidayati and Winda Septiana Arisandi. The title is The Correlation Between Happiness Levels and Quality of Life in Elderly. The purpose of this study to determine the correlation between happiness level and quality of life among the elderly residing in a nursing home. And the conclusion is the study concluded that the strong and significant correlation existed between happiness and the quality of life. And of the higher the level of the happiness of the elderly, and the greater their quality of life. Okay, I think that's all for the first presentation. And we will see at the second presentation. Thank you.
Selamat datang di PT Kairos Jaya Sejahtera, sebuah perusahaan PMDN yang didirikan di Kabupaten Sleman, Daerah Istimewa Yogyakarta pada tahun 2014. Kami hadir untuk memberikan pelayanan distribusi khususnya dalam bidang laboratorium. Visi kami adalah untuk menjadi distributor berskala nasional yang menjadi pilihan utama bagi pelanggan dan mitra usaha. Dengan berlandaskan pada nilai profesionalisme dan humanisme, mendorong kami untuk melakukan kegiatan distribusi yang terstandar, sehingga mampu memberikan layanan dan produk yang berkualitas. PT Kairos Jaya Sejahtera hadir untuk menjadi mitra dalam setiap kegiatan laboratorium Anda. Kami memiliki rentang produk yang luas untuk melayani kebutuhan laboratorium, seperti produk untuk penelitian genom dengan menggunakan PCR, penelitian protein dengan metode Western blot, immunohistochemistry, ELISA, dan bioassay lainnya. Penelitian mikrobiologi, sel kultur, kimia analisa, dan penelitian terkait life science lainnya. Pelayanan informasi yang detail terhadap produk dimulai dari tahap pre-order hingga after sale service menjadi kunci keberhasilan kegiatan laboratorium pelanggan kami. Standar operasional prosedur dalam kegiatan distribusi diterapkan sedemikian rupa sesuai dengan kebutuhan setiap produk. Proses penerimaan, penyimpanan, dan pengiriman barang diawasi dengan ketat sesuai dengan standar mutu yang ditetapkan. Didukung oleh sumber daya manusia yang terlatih dan sarana prasarana yang terkendali, menciptakan sinergi dalam menjaga mutu produk selama distribusi. Sistem informasi perusahaan yang diintegrasikan pada semua divisi meningkatkan kecepatan dan akurasi data dalam kegiatan distribusi, sehingga proses distribusi dapat berjalan dengan prima. Kami, PT Kairos Jaya Sejahtera, memberikan layanan purna jual untuk memastikan terciptanya kepuasan pelanggan. Kami melayani diskusi pada tahap pemilihan spesifikasi demi mendapatkan produk yang sesuai dengan kebutuhan pelanggan. Pendampingan kegiatan laboratorium dalam rangka menciptakan keberhasilan penggunaan produk adalah salah satu fokus kami dalam melayani pelanggan. Selain itu, dengan senang hati, kami akan berkolaborasi dalam kegiatan pengembangan laboratorium. Berkat anugerah Tuhan yang Maha Kuasa, serta segala usaha dan komitmen dari seluruh tim PT Kairos Jaya Sejahtera, sampai saat ini PT Kairos Jaya Sejahtera dapat melayani distribusi ke sebagian besar wilayah di Indonesia. Dengan semangat, doa, dan upaya dalam menjamin mutu distribusi, PT Kairos Jaya Sejahtera akan melayani dengan lebih baik dengan harapan akan terciptanya kesuksesan dan kemajuan dunia usaha, ilmu pengetahuan, kesehatan, dan bangsa Indonesia.
Tes satu deh. Ladies and gentlemen, we continue to the second speaker. For the second speakers, we have Prof. Intansari Nurjana, Bachelor in Nursing, Magister in Nursing Science, PhD. Prof. Intansari will share the topic of complementary therapy to enhance the qualified workforce and improve community health. Hello, Prof. Intan. Are you with us now?
Good morning. Hello, good morning. How are you?
Good morning. How are you, Prof? We are fine now.
Alhamdulillah. Thank you.
Thank you. I will read the Professor Intansari's profile. Please, the committee share the curriculum vitae of Professor Intansari. Professor Intansari is a professor and senior lecturer in the Department of Mental Health and Community Nursing, Faculty of Medicine, Public Health and Nursing, Gajah Mada University in Yogyakarta, Indonesia. She's an expert in alternative complementary therapy in nursing, mental health nursing, and community nursing. She is an active in research, especially in complementary therapy, and publishes so many articles in national and international journals. She also writes books. In the last 3 years, she has been recognized as a reviewer, editor, assessor, invited speaker, and has received awards. Prof. Intansari, you have 30 minutes to present your paper.
Thank you very much.
Ladies and gentlemen, please welcome Professor Intansari.
Okay, thank you very much. Can you hear my voice?
Yes, it's clear, Prof.
Okay, thank you.
Thank you.
Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Allahumma shalli ala Muhammad wa ala ali Muhammad. I think we need to thank first to our God, as we can be in a healthy condition and we can also share many knowledge in today's activity. Firstly, I'd like to share about the PPT so everybody can see. Okay, can you see this? Can you see my PPT? Is my PPT already in your screen? Anyone can respond me, please?
Yes, Prof. We
Yeah.
can
Okay.
see it.
Okay. So, I'd like to. So, my topic is about the complementary therapy to enhance qualified workforce and to improve the community health. In here, I would like to present about how to improve community health and how to enhance qualified workforce and what is complementary therapy, and also the lesson learned from I've done regarding this topic. Community health refers to the health status of a defined group of people and the action and conditions to promote, to protect, and to preserve their health. So that's the definition of community health. The qualified workforce itself is a highly qualified workforce that can adapt better to businesses' quickly changing needs, and education also helps to spread the knowledge. So how to improve the qualified workforce? Firstly, we need to identify the target, because our target is to improve the community health. So we need to identify what is the problem in the community, because based on the information about what is the problem in the community, so then we can make a plan about what we will need to do to deal with the problem. Second one is we would like to identify the gaps of the problem in community. The gaps can be lack of resources, like the number of human resources, or lack of method to solve the problem, because we need the most efficient, less effort, less costly, and quick result to deal with the problem. And the third one is we need to identify the skill gaps in the workforce. Based on this, then we can make a plan. The plan is including the training and development that's really needed in the meantime. So, what is the major problem in community? We know that we want to make it in general, because there are so many problems, but we can make it, or we can draw one conclusion. The most problem is physical complaints, which is pain. Pain is related to many diseases. whether it's communicable and non-communicable disease. And we know that the ratio of health worker to population still not in balance, so we have work overload. So that will also influence the wellness of health worker. We know that health worker also a normal human being, which is they can be exhausted if they have to look after beyond their limit energy and beyond the limit time. Then what is the possible solution? Firstly, this is possible to increase the number of health workers, but that will take a long time because, maybe the health worker need to go for education like several years. Or maybe other possibility is the health worker can be spread what is called proportionally, because sometimes many in the big city but less in the remote area. Then the second one, if we want to have a solution, maybe we need to have innovation to reduce the workload. So previously, maybe two nurses, for example, have to look after 20 sick people, maybe in the community. But then because we have a technology, for example, so then they can easily manage the time, manage the energy, so that will be less energy need to look after 20 people. Maybe also another is long distance consultation, because as you know, like if a nurse have to visit the home, like doing home visit, then it takes transportation. Maybe if far away, it takes many hours. So by long distance consultation, that will reduce the time that needed to look after the people. That's another solution. The last one may be how to improve the knowledge and skill of health worker, because by having a specific skill, so they can help people more efficient, less time, but have a good result. So what the choices of skill to be achieved by a health professional? So in my experience, the skill need to be achieved by health professional, maybe a complementary therapy, because it can help for assessment, like to have a detection risk. Maybe many people here, they don't really hear about iology, iridology, sclerology, or TCM is traditional Chinese medicine, or physiognomy. So this is another way with very cheap, very less costly, like for iology, like for sclerology, is seeing the eyes of a person who's sick. Then in the sclera, we can see many lines, like the red line. Sometimes the color of sclera is a bit yellow or a bit brown, which is for the people who already learn about this, they know that what's going on in the body. So it's very cheap. Like we can see heart problem is very easy in eyes in the sclerology. So in my experience, for example, if someone said I got a chest pain, then I will check the eyes. Is there any red line in the area or not? If there is in the specific area, then I can say that this is a heart problem or different problem, kind of thing. Physiognomy is kind of how we read the face, but mostly people with wrinkles. Like if you can see the face, then we know where is the area for large intestine, area for kidney. If there is a different color, then it's really easy to have a prediction. Of course, this is not absolutely correct, but it is the first detection and assessment. Complementary therapy also, complementary also has intervention, of course. There are many type of complementary therapy like massage, like massaging. So many different type of massage. Hypnotherapy, cupping therapy, homeopathy, acupuncture, acupressure, or herbal or in Indonesia it's called jamu. And another one is sujo. So many and many more. And I put the color red there because in this presentation, I'd like to present you about the sujo. What is sujo? This is a Korean language. Korean language is su means hands and jo means foot. Feet. Foot or feet. Two. Right. So sujo means hands and feet. Who found the sujo is Professor Park Jae-woo from South Korea. North Korea. And what is the sujo therapy looks like? As you can see here, the methods to dealing with the health problems. Remember, sujo not only can target the physical, but also the mental, emotional through the modification in our hands and our foot. But mostly I work on hands. Sometimes I work also on feet when the problem is severe, then we need more therapy. So what we do on our hand is by doing massage or put a color like in the coloring pen, something like that. And move some of that something to make it happen. I'm sorry. Any people talk? Hello? Can I continue? Okay, can I continue? Yeah. Then we can put magnets or seat, seat. We can use light, needles, and others. Sometimes you use what is called smile meditation, twist, or something like that. So that's the type of sujo therapy. I'd like to continue with this and work this one next. Okay, this is the example of therapy. Can you see that the color? Like that. Actually, this is the advanced one. And also you can see another this is for the person who has got a grade 2 of breast cancer. Now she's still doing it until it's already 10 days. 10 days since last week. Yeah, still in process. And this is a bit history of sujo knowledge. There are about 200 books of Professor Park Jae-woo, 1987 started the book, and then other in Tri-Origin, 1994, 60 book, and the last before he passed away in 2010 is called Tri-Origin Science Theory. This will include the human dimension, which are body, mind, life, and soul, and it can target the cause of problem. Like when it was COVID, so we try to destroy the virus, the COVID virus, using this Tri-Origin. But the basic one is this one, the sujo correspondent or correspondent system. That's the basic one. So in Indonesia, before that. I personally choose sujo. Previously, I also learned many other complementary. But then when I meet the sujo, it's easy to be applied. It's safe. It's cost effectiveness and relatively quick result. And of course, as I already mentioned, it can target the physical, psychological, and other problems. In Indonesia, it started in 2019, and there is a national examination to be a sujo therapist. Okay, let's see what kind of case that can be solved by sujo. For example, this is pain in the right thumb. it's a chronic one. We've done what is called activity in one hospital for doing this activity, like what is called pengakmas, community services. This is a female, is 39, suffer from pain about 15 years. This is the therapy. Just 10 minutes and the pain gone. Just doing like that. This is the advanced therapy. Easy but advanced therapy. Okay. Yes, just 10 minutes. And then this is another one. It's swelling in the eyelid. This is also advanced one. I usually apply advanced one because I already learned the advanced, and for me it's easier by putting like a color on finger. Then this is the result. This is the people. This is not Indonesian people. This is from India. So I got many patients from overseas. This is before the therapy. After 3 days gone. This is the female one. Okay. And so that also can be applied for Bell palsy. So this is the many type of therapy, but I show you some therapy like this. I can't remember which day, but I've got the full record. But this is the therapy for the one who has Bell palsy. Another day, I use the magnet. This magnet one. Yeah, I let her like this for about 1 hour, and this is the example how to use magnet for her hand, her finger. This is another picture how to do the therapy. And after that, this is the result. But 12 days, this is before, and this is after 12 days. That's the result. So the face is already symmetrical. Maybe another example is the growth and development on child. So there's someone contact me about the problem of speech articulacy. You can see it has a yeah, it's difficult to say red, white, and green. Then I offer the therapy using the triogen, and the parents, the mommy, apply it on the child's finger like that. There is a sequence how to put the color. So this is not something which easily to be done, but we need to be careful how to put the color. So this is the right hand, and this is the left hand. And after about 40 days, this is the result. How to pronounce merah, putih, and hijau. Yes, that's the difference. Okay. Then one other sample is about the how to reduce the level of fear on COVID patient, which is we already published it in a journal, and this is how to do for reducing the feeling of fear.
Pada rasa takut, caranya di-printer dulu ya, ditulis, dipegang di situ, kemudian di-printer ke arah jempol. Dilakukan selama 2 menit, atau kalau mau dihitung 120 kali.
Then we put the seed.
Sebenarnya yang titiknya yang diperlukan itu hanya 4 titik dan puas.
You make it quick. So we put like that. This is a different way. So it's really safe, and patient they don't feel treated. So feel nice. Okay. Then now we go to lesson learned. I don't know how much still I have time. Anyone maybe can tell me how much time I have still?
You still have 13 minutes, Prof.
Okay, thank you. Okay. Now, how to improve the qualified workforce? So we have done training for health worker to be a subject therapist. It was in June 2023, 3 times online. One time is 1.5 hours. Then one practical activity. Yep, we looking after the patient about 4 hours, and then a national examination about 3 hours. And how many health worker? 20. It was nurses, midwifery, dentists, environmentally health worker, kind of them. So many from the what's called a puskesmas or public health. This is the picture of a practice field. As you can see, nurses, they're looking after the patient, the community by doing job here. This is the job basic because Indonesian examination is only cover basic. This is also the chief of Puskesmas doing job. This one in another place. You see, this is the nurse from Turi Sleman. Yeah, and this is the national examination. They're doing a test. Alhamdulillah, they all passed, so they got the certificate as a therapy. So you can see the example of their comment. Can you see the YouTube channel? Anybody can respond me that? Do you see this YouTube? Hello?
Not yet, Prof.
Not yet. So we have to stop stare. Right? I need to share the YouTube channel. So this is one of the health professional from the hospital. It's
terkait job itu awalnya saya ikut seminar tentang perawatan luka di Wokna. Di seminar tersebut kebetulan ada narasumber Bu Intan terkait dengan terapi komplementer yang disampaikan adalah sejok nafas. Itu saya memperhatikan kayaknya ini ya menarik sekali terapinya secara dan sistematis, dan saya berpikir bahwa itu adalah terapi yang betul-betul bisa membantu untuk memulihkan kesehatan. Setelah itu saya kontak dengan beliau mencari informasi untuk mempelajari seperti apa, dan saya mendapatkan informasi kalau itu ada semacam pelatihan yang akhirnya saya mendaftar ikut pelatihan tersebut. Pelatihan tersebut itu sebenarnya 1 bulan, ya sekitar ada mungkin 8 kali pertemuan secara online dan offline. Nah, dari pembelajaran awalnya adalah online. Pembelajaran ini walaupun lewat online, betul-betul belajar ini secara sistematis, artinya kita saat pelatihan ini menggunakan Zoom, dilatih kaitannya dengan teori, langsung praktek dengan menggambar, terutama menggambar bagian-bagian tubuh ataupun alat tubuh. Kita sebagai terapis harus tahu titik-titiknya, karena memang sujok ini sujok tangan dan sujok untuk kaki, jadi kita harus mengetahui titik-titik di tangan dan kaki.
When I open my eyes, I cannot see. When I touch my hand, I cannot feel. I am stuck in my mind, I can't explain. Please forgive me when I'm lost and far away. I need your love and I need I don't wanna go back, I will change my life today. The world is cold and I need you today.
I'm siapa di praktek ya, alhamdulillah saya kemarin sudah dapatkan 2 pasien. Pasien pertama adalah pasien dengan keluhan itu bagian tubuh kanan agak berat, kemudian kita kaji, kemudian kita tiga, alhamdulillah ketemu, kemudian kita terapi dengan massage sebentar, kemudian dilanjut dengan terapi PG yaitu venogrip, dan alhamdulillah pasien merasa nyaman karena pasien merasa bahwa di pinggangnya itu merasa lebih nyaman, termasuk di pinggang kanannya, karena pasiennya ini punya tekanan darah tinggi terkait dengan ginjalnya, sehingga dengan terapi tersebut lebih nyaman. Kita masih pilih dan pasti dapat dari sini pada kita lihat kita memahami all salah kita proses apa ini itu bukan kita kembali kami sebelah sana sih.
Okay, that's the example. You can see the next one if you want. Another example from community health stuff. Okay, let's see the next one. Okay, how? I'm sorry, I have to go here. Okay. So, we have many training activity, sometimes with the community health workers, sometimes from the nurse in the hospital. And now we want to see the result, the long result of the community health. It was Posyandu activity was done by Puskesmas Bantul 2. This is a picture. And this one also community activity with the nurse who already got the certificate from as a certificate as a job therapist. So this is the example of female experience pain on her heel after the sujud therapy by nurse Latifah from Bantul. Let's see how what she said.
Nama saya keluhan saya kaki kiri tungkak saya itu terasa nyeri setelah diterapi sama Ratus Alfa dari Puskesmas sudah agak ringan betul agak berkurang sakitnya tapi dari manis sebelah kanan.
Okay. So the nurse in this Puskesmas is actively done activity because they already got the certificate as a sujud therapist. This is another example from the same activity.
Okay. Anjelir, sakit tangan, gerakkan ke sakit, dan konten dan kita kali menit, ini sakit perut tidak gerakkan, jadi kita pun sakit lebih. Oh, aku buat bawa di pas tahun gerak-gerak tapi tahu kok jadi sakit sebelah.
Yeah. So as you can see here that only with a very short time there will be a result, inshallah. Mostly result. Even though sometimes it's not recovery 100%, but maybe you just need to do it again, something like that. So, but the activity or the therapy is really quick. And if you want to know more therapy or more application of sujud therapy, you can go to this YouTube channel. This is one. The last one is Kista, cyst in the uterus. Still in process now, 2 months already. But after they apply it for 1 month, there is no more pain after menstruation. Usually The pain comes after menstruation, but last one month after the application, no more pain. And the second month, I think, should be this month. I will follow up again. So this is the chosen references if you want, and this is me. You can contact me by email or by mobile phone. Okay, thank you. That's, I think it's already 28 minutes. I think that's all my presentation. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Prof. Intan, we apologize for technical error during your presentation. Thank you very much, Prof, for your presentation. It's very interesting and insightful. I just learned about the sujok, then it's new for me. I'm curious about sujok because it's new for health. I'm sure there will be many questions from the participant. But the first, let me conclude the small conclusion from your presentation that it's important to improve the knowledge and skills of health workers through complementary therapy like sujok to improve community health, especially in Indonesia. Okay, now I will like to give opportunity to the participant who want to ask to our speaker, Prof. Intansari. You may raise your hand or chat in the chat room. Now let us see the question from the participant.
There are many questions here.
Please, the committee, bring the question on screen. If there are a question.
I think I can read here. Should we wait, or can I just read the question here?
Okay, I'll read the question for you, Prof.
Yeah,
The question comes from Rizky. Okay, should the health worker certified or take special training or course before they are able to implement sujok therapy? Our organization?
Yeah, I think I can answer that. Actually, to implement sujok therapy, we need the training, but it's depend on if you want to try to have the skill in a very simple way. So the training also not long. So it depends on what you need. But of course, even though if you don't have the certified for this skill, you still can apply for your family, for your neighbor. But in my recommendation, if you are a health worker, so you need to have certification because that shows your legal action, so that will be safe for you if you want to implement to other people. I think that's my answer. Hope that answered the question.
Thank you for your answer, Prof. Intan. The second question we have in the chat room. The question from Dila Afika. What is the most challenging to improvement sujok therapy in the community?
Okay. What is the most challenging? The most challenging is when people they don't believe it. Because it is sometimes very simple. Sometimes, like if you wanna check it in the YouTube channel, you can see people just doing like this or doing like this, 10 minutes. Like yesterday, I got someone who got what is called arrhythmia, and I just put the four color each hand, and I put like this, and 10 minutes the arrhythmia comes. So it looks like how come it's happened like that? But actually the knowledge is very deep. Professor Park Jae-woo books are like 700 pages. Some little maybe 100, or the Triorigin one is about 700 pages. So I think the challenging is that people only believe when they feel better. So usually we offer them like a therapy if they got problem, pain here and pain there, and then they have no reason not believe because it's already helped them and cured them. Okay.
Thank you for your explanation, Prof. It's clear to us. But we have the last question. The last question come from Safar. Can this complementary therapy be carried out by the three nurses and specialists without getting a certificate? And is this therapy safe for elderly stroke sufferer?
Okay. Actually, even for a housewife, if they learn where is the point, like for example, I got headache. Head is on the thumb. So you just press on the thumb here with pencil or with something else. Inshallah will get better. So even there is no need education for that. But the certificate is really important only if you want to apply like in commercial or in institution or something that legally done. You know what I mean? So if you really need, if you are a health professional, I think you're supposed to have it. And you can learn in the higher level in Sujot. So there are many levels. For housewife, maybe they can only solve the problem like headaches, but sometimes the headaches not gone still. So we need a higher level of Sujot therapy, which is the housewife cannot apply it because they don't have a knowledge of it. Okay.
Okay, thank
Then,
you, Prof.
The therapy safe for elderly stroke sufferers. Yes, maybe in the next week maybe I will show you in my YouTube channel experience to look after stroke patient, which already done about 2 months now. But the stroke is already long time, so he's got the kind of weak on the right extremities or left. I can't remember. I have to check it. So you can see from the YouTube there are many cases, even the difficult cases like like something there is no blood flow on the frontal area of brains, kind of that. So people that men always feeling like headaches, mostly many frequently feeling headaches. So by using Sujo, Alhamdulillah, it's already here. So you can check it on the YouTube. In other body or just on our hand. Oh, okay. This is another question, I think. Can I just read this and answer it?
Okay, yes, Prof.
Okay. Let me introduce myself. My name is Putu Juni. I'd like to ask Professor Intan, can all patients undergo Sujud therapy or other specific condition for certain patient? Everyone can apply Sujud therapy. It can be done for everyone, children, even elderly, as long as they get hand and if they get food. But if they don't have it, there is also a therapy on ear, which is I usually not do it, but there is a book about that from perspective. So where is the heart on the ear, where is the kidney on the ear, there is a many information from Professor Pakje. Okay. Hope that answered the question from Hani. Thank you for the material, Bro Intan. This is something new for me. Can we do the sujud therapy in other area in our body or just in our hand? Of course, we can apply in our hand. But Professor Park Jae-woo already found easier the simplest one, so we can reach everything in our body just through our hand. With the simple one. If you want to apply the simple one, please. If you want to apply the more complicated, more difficult one, is up to you as well, actually. But for me, I feel better. I feel easier to use the hand and only foot. I think already the question. No more question, I think.
Okay, no more. Okay, because we are limitation by the time, we close the second topic, the second session. Thank you very much, Prof. Intansari, that we give us a new insight, especially sujok therapy. We will be happy if you stay here until the end of the morning session, but if Prof. Intan have another activity, feel free to leave the Zoom. Thank you, Prof. Intan. Ladies and gentlemen, give applause to Prof. Intansari Nurjana. Now we will hear for the presentation from Yakult Company.
Good morning. Thank you very much for this kind of opportunity that from the committee of the Unjaya International Conference and Healthcare. Thank you very much for the distinguished speakers. Very huge knowledge that that can share and very good in our living. And that now let me introduce myself to opening up my talk. My name is Mangasa Siregar from the PT Yakult Indonesia Persada in Jakarta, and I'm the PR science in the Yakult. And right now, I want to sharing about how the lactic acid bacteria probiotic can maintain the quality of life. So let me share my presentation first. Okay, thank you very much. Okay. Okay. The topic of the my sharing is the role of the probiotic of LCS for maintaining quality of life. And from the beginning, I want to maybe remembering the Mr. Hippocrates, our father medicine. He said that our food should be our medicine, and our medicine should be our food. That is very true, because when we eat something that is mirroring to our healthy, the intestine are the front line of the nutrition absorption and then our immunity. So that's why the largest of immune organ in the human body in our intestine to protect from fragile infection. That's why we keep our intestine to healthier. So please, we eat a good diet, good balance of nutrition to make our healthy. And then bacteria living in our intestine, and maybe we all already know that the gut bacteria is very huge in our intestine. 100 trillion bacteria in our intestine. So the bacteria can be divided into 3 groups. The beneficial bacteria, and then the neutral bacteria and the harmful bacteria. We must keep the balancing of these bacteria, because when beneficial bacteria decrease and harmful bacteria can make the optimum in our intestine, it adversely affects to our health. So the balance of the gut microbiota is very important. As we can see in here, the aging in the senior years of life, change in the intestinal flora begin to take place. In the characteristic trend, the decrease of the bifidobacteria and increase the Clostridium perfringens. And then the unbalanced diet, yeah, maybe our meals high in the protein and high in fat, salt and sugar, to an excessive amount of protein fat in the intestine, which can cause a harmful Clostridium perfringens to increase along with the decreases of the bifidobacteria. And then the medicine with antibacteria, and then stress, overwork, it a very very bad impact in our intestine. And then the bacterial infection, because when contaminated the food poisoning bacteria, which increase in the number inside the intestine and produce toxin, the intestinal lining becomes damaged, and there is no considerably upset in the balance of the intestinal flora. So we must take the probiotic in our food, because the various of the diet, it can make a various of bacteria in our intestine. We can see the rich in the intestinal life change in the bacteria in artificial gastric juice, because the probiotic condition must the bacteria can live in our intestine. So you can see in here L-casein strain before exposure, and then 60 minutes after exposure, so the left bacteria still in there, and the common lactic acid bacteria before exposure, and 60 minutes after exposure, that bacteria appear in the red. So what the function of LCS when reach alive in the gas in our intestine? So the LCS can produce lactic acid and prevent the dysbiosis and stimulate organic acid production in our intestine. The organic acid can regulate gut peristaltic, so can be improvement of gut disorders like constipation or low stool or diarrhea, and then reduce harmful substances. And secondly, it can modulate immune response. As we know that 70% our immune in our gut. So when our gut is very healthy, that can prevent our gut from infection like acute diarrhea, infection norovirus, upper respiratory tract infection, and post-operative infection, and can be a reduction of the cancer risk like a colorectal cancer, bladder cancer, and blood cancer. And there is a communication our intestine to our brain. We know the brain gut axis from the vagus nerve. So if our gut is very healthy, it can be suppressed maybe a sleep disorder and stress effect else. Okay, this is the LCS can help increases a good bacteria and suppress the bad bacteria. How the bifidobacteria can increase if we taking a caseation testin from the non-drinking, and then Enterobacteriaceae can be suppressed in the intestine when taking a L-casein strain. And then LCS can help prevent digestive disorder. The effectivity is 80% and can effectively in diarrhea 80.1% and constipation 82.2%. And then LCS can be help reduce toxin in the intestine. As we know, the toxin like indican from the food that our eat can be decreased if we drink periodically LCS and reduce the paracresol in our urine. So that's why LCS can be reduce the toxin in our intestine. And LCS can help to increase our immune, such as NK cell or natural killer cell. This is the study from Japan, how the 9 healthy individual, 5 female and 5 male, consume LCS drinking at 3 weeks. And the result, as you can see in here, when they drink the 3 weeks of Yakult, the NK cell can be increases. And then after that, there's no drinking Yakult again. So what can happen? The NK cell can be raised, but until 6 week, he getting lower. So that's why we must continue to drink LCS. Natural killer cells activity is the one of the immune in this because the one of function to protect our body from the viruses, cancer, and other harmful entities. One, ingesting harmful entities such as macrophage. Two, defending against cancer and virus-infected cells such as NK cells and producing the antibody like a B cells. So at the NK cell activity, the strength of NK cell that defend against cancer and virus-infected cells and can be up NK cell activity when we drink Yakult. Not the total NK cell, not only the activity. Only the activity can be raised when we drink LKC regularly. So this is the new scientific evidence LCS in the India. Number one, this is the how the children 1 till 5 years in Calcutta, India, had diarrhea, acute diarrhea, and when they drink Yakult can regularly can prevent 14%. And number two, this is the LK613 can reduce stress symptoms in the student in Japan, faculty medicine in Tokushima University in Japan, by suppressing the production of the hormone cortisol, as we can see in this graphic. And when they drink Yakult, cortisol hormone is very lower from not drink Yakult. And then the research in Japan in 77 elderly people that consumption of LCS when the winter season, so the fever that occur very commonly in Japan to the elderly, it can be only 1.5 days versus 2.7 days from the infection of norovirus. As you can see in here, the green bar is drink Yakult, the group of drink Yakult, and the red bar, the group of no drink Yakult. Yeah. And then fourthly, the women who regularly drink LCS, frequently from the youngest until 55 years old, it can be suppress the breast cancer to expose. We know our intestine have transmit from the brain to the intestine and then the intestine to the brain. So LCS or Yakult, that already given the label FOSHU from Japan Consumer Affairs Agency since 1998, and then already certificate GRAS, generally recognized as safe from FDA United States since 2012, and then already have the certificate halal MUI, and then the Piagam Bintang 3 food safety, and right now available in the 40 countries and region and worldwide. I think that's only my presentation. For the closing remark, the quality of life can be maintained if we implement the balanced diet, pola hidup bersih dan sehat, and continuous consumption of the probiotic that based on the scientific evidence. Okay, I wish to you happy 6th healthy National Day. Move together and healthy together. Thank you for the kind attention. Thank you very much for having me. I give back to the moderator. Thank you.
Thank you for Yakult Company. That Yakult Company is one of the unique sponsor. Thank you for presentation about Yakult product and benefit. Okay, now we are going to the third speaker. Okay, we continue to watch the profile video.
Yogyakarta adalah kota yang penuh dengan sejarah, budaya, dan semangat kebangsaan. Kota di mana setiap jalan berasa dijahit erat dengan kisah-kisah kepahlawanan dan pengabdian kepada negara. Dan di tengah-tengah gemerlapnya Yogyakarta, terdapat sebuah institusi pendidikan yang mengemban misi besar. Selamat datang di Fakultas Kesehatan Universitas Jenderal Ahmad Yani, sebuah tempat di mana semangat kebangsaan dipelihara dan para pemimpin masa depan kita dibentuk. Di sini, para pendidik bekerja tanpa lelah untuk memastikan bahwa pendidikan yang diberikan sesuai dengan standar tertinggi. Mereka adalah pemimpin yang bijaksana yang membimbing mahasiswa dalam perjalanan mereka mencapai mimpi dan potensi tertinggi mereka. Fakultas Kesehatan Universitas Jenderal Ahmad Yani memiliki 8 program studi unggulan. Program studi keperawatan S1 merupakan program studi yang mempersiapkan mahasiswa untuk menjadi perawat yang berkualitas. Melalui pendidikan ini, mahasiswa akan mempelajari berbagai aspek perawatan kesehatan, termasuk pengetahuan medis, keterampilan klinis, etika, dan manajemen dalam konteks pelayanan kesehatan. Program studi profesi nurse. Program studi ini mengacu pada program profesi keperawatan yang ditujukan bagi individu yang telah memiliki gelar sarjana di bidang lain, tetapi ingin mengejar profesi keperawatan. Program ini biasanya lebih singkat dan fokus pada keterampilan klinis dan persiapan untuk ujian lisensi keperawatan. Program studi kebidanan D3. Program pendidikan kebidanan tingkat diploma D3 mempersiapkan mahasiswa untuk menjadi bidan yang terampil dalam memberikan perawatan kesehatan kepada ibu hamil, melahirkan, dan pasca melahirkan. Mereka juga terlibat dalam perawatan bayi baru lahir. Program studi kebidanan S1 merupakan program studi yang lebih lanjut dalam bidang kebidanan, memberikan pemahaman yang lebih mendalam tentang kehamilan, persalinan, dan perawatan pasca melahirkan. Biasanya program ini memberikan perspektif yang lebih luas dan mendalam dalam kesehatan reproduksi perempuan. Program studi profesi bidan. Program studi ini mengacu pada sertifikasi atau lisensi bidan yang telah menyelesaikan pendidikan dan pelatihan yang diperlukan, serta telah lulus ujian sertifikasi atau lisensi sesuai dengan regulasi nasional. Program studi rekam medis dan informasi kesehatan. Program studi ini membekali mahasiswa dengan pengetahuan dan keterampilan untuk mengelola informasi medis dan kesehatan, termasuk pengumpulan, penyimpanan, analisis, dan penggunaan data kesehatan yang penting untuk pengambilan keputusan klinis dan administratif. Program studi teknologi bank darah. Program studi ini fokus pada pengembangan teknologi terkait pengelolaan dan penggunaan darah dalam konteks pelayanan kesehatan, termasuk proses pengumpulan, penyimpanan, pengujian, dan distribusi darah, serta produk darah lainnya. Program studi farmasi. Program studi farmasi mempersiapkan mahasiswa untuk menjadi apoteker yang berkualitas. Mereka mempelajari tentang obat-obatan, dosis, efek samping, interaksi obat, dan cara memberikan informasi dan layanan farmasi kepada pasien. Di sini, kami bangga menyediakan sarana dan prasarana yang memungkinkan mahasiswa untuk meraih potensi terbaik mereka. Ruang kelas kami didesain dengan nyaman untuk menciptakan lingkungan belajar yang inspiratif, dilengkapi dengan teknologi terkini dan fasilitas yang memadai. Setiap kelas mencerminkan standar kualitas tinggi kami dalam pendidikan. Ruang tutorial. Tempat di mana diskusi dan interaksi antara dosen dan mahasiswa menjadi inti dari pembelajaran. Ruang tutorial kami dirancang untuk mendukung kolaborasi dan pemahaman mendalam tentang materi pelajaran. Lab terpadu. Lab terpadu kami menyediakan fasilitas lengkap untuk eksperimen dan penelitian lintas disiplin ilmu. Dengan peralatan modern dan ruang yang luas, mahasiswa dapat mengeksplorasi konsep-konsep ilmiah secara praktis. OSCE Center. Di sini, mahasiswa dapat mengasah keterampilan klinis mereka melalui simulasi yang realistis. OSCE Center kami dilengkapi dengan fasilitas terkini untuk mempersiapkan mahasiswa menjadi profesional yang siap berpraktik. Lab komputer. Fasilitas lab komputer kami menyediakan akses ke perangkat keras dan perangkat lunak terbaru. Dengan ruang yang nyaman dan fasilitas lengkap, mahasiswa dapat mengembangkan keterampilan teknologi yang diperlukan di era digital ini. Lab CBT Computer Based Test. Lab ini dirancang khusus untuk ujian berbasis komputer, memungkinkan mahasiswa untuk menguji pemahaman mereka dalam format yang interaktif dan adaptif. Ruang webinar. Kami juga menyediakan ruang webinar yang dilengkapi dengan teknologi mutakhir. Ini memungkinkan kami untuk menyelenggarakan seminar, workshop, dan presentasi online yang interaktif dan informatif. Asrama mahasiswa. Untuk kenyamanan dan kemudahan akses, kami menyediakan asrama mahasiswa yang modern dan aman. Ini adalah tempat yang nyaman bagi mahasiswa untuk tinggal dan berkembang dalam suasana akademis yang mendukung. Perpustakaan. Koleksi perpustakaan kami mencakup berbagai sumber belajar mulai dari buku cetak hingga jurnal elektronik. Ini adalah tempat ideal bagi mahasiswa untuk mengeksplorasi pengetahuan. Student Corner, tempat bertemu, berdiskusi, dan berkolaborasi antar mahasiswa. Student Corner adalah pusat kegiatan sosial dan akademis di kampus kami. Lapangan basket. Untuk menjaga keseimbangan antara belajar dan kesehatan jasmani, kami memiliki lapangan basket standar. Ini adalah tempat yang sempurna bagi mahasiswa untuk melepaskan energi dan menjaga kebugaran fisik. Apotek. Kami juga menyediakan apotek di kampus, memastikan kebutuhan kesehatan masyarakat umum dan mahasiswa terpenuhi dengan baik. Universitas Jenderal Ahmad Yani siap membentuk para Ahmad Yani muda yang nasionalis, patriotik, heroik. Bersama-sama kita akan melangkah maju menuju masa depan yang lebih baik untuk Indonesia yang lebih besar. Mari kita bersama-sama menjadi bagian dari perubahan di Universitas Jenderal Ahmad Yani.
Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta saat ini mengelola 8 program studi. Program studi Pendidikan Profesi Nurse, Prodi Profesi Bidan, Prodi Keperawatan S1, Prodi Kebidanan S1, Prodi Farmasi S1, Prodi Kebidanan D3, Prodi Rekam Medis dan Informasi Kesehatan D3, dan Prodi Teknologi Bank Darah D3. Ditunjang fasilitas yang lengkap dan terstandar untuk mencapai kompetensi keahlian, serta semua program studi yang telah terakreditasi oleh LAMPTKES. Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta siap mendidik dan mempersiapkan para Ahmad Yani muda bidang kesehatan sebagai generasi penerus kejayaan bangsa Indonesia.
Okay, now we are going to the last session, in the morning session. Our keynote speaker is Dr. Ira Cyndira Tresna, Magister of Communication Science from the Indonesian Ministry of Health. Dr. Ira will share the topic of resilience in healthcare society. Hello, Dr. Ira. Are you with us now? Good morning, Dr. Ira. Okay, Dr. Ira already with us in a Zoom meeting. Hello, Dr. Ira. Okay, let me introduce the Dr. Ira Cyndira Tresna. I will read the curriculum vitae. The committee helped me to share the curriculum vitae of our speaker.
Abang apa?
Hello, Dr. Ira. Can you hear my voice? Can you hear me? Hello, Dr. Ira. Okay, I will read the Dr. Ira curriculum vitae. She was born in Bandung, and she was graduated from Mercu Buana University in 2016 for magister degree. Currently, she is an acting director Center of Health Resilience and Health Resources Policy Health Policy Agency Ministry of Health of Republic of Indonesia. She got a lot of achievement from Indonesian Red Cross, Satya Lencana from Indonesian President, and the last reward from Ministry of Health. She also active in conference national and international. Dr. Ira, you have 30 minutes to present your paper. Ladies and gentlemen, please welcome Dr. Ira Cyndira. Dr. Ira, time is yours.
Thank you, moderator. I'm sorry, I have a little bit of technical background before.
Okay, Dr. Ira.
Okay, can the committee run my slideshow?
Okay, please, the committee. To share the PPT. Please, time is yours.
Okay. Bismillahirrahmanirrahim. Assalamualaikum. Very good morning to you all. Honorable Mrs. Ida Nursanti, Eskep Nurse, MPH, Dean of Health Faculty, University of Jenderal Ahmad Yani, Yogyakarta, respected lecturers, researchers, and health professionals, students of health science of University of Jenderal Ahmad Yani, Yogyakarta, and all participants of the first Unjaya International Conference on Healthcare. First of all, I would like to express my gratitude to be part of this event in the first Unjaya International Conference on Healthcare. Thank you, Ibu Din, for this wonderful opportunity. Today, we gather to explain clinical aspect of health resilience, a fundamental part of our national agenda, which is crucial for our national future. Next slide, please. Next slide, please. Thank you. As we move toward 2045, the Indonesian government is committed to realizing the Indonesian Golden Visions 2045, which Indonesia Emas 2045 ya. This ambitious roadmap aims to establish Indonesia as a sovereign, developed, and sustainable country. Health for all is one of its central pillars, directly impacting our human resource quality by prioritizing affordable quality healthcare access for every Indonesian. We are not only investing in health, but laying the groundwork for sustainable development and long-term progress. Next slide, please. In 2023, the enactment of the Omnibus Health Law marked a key milestone in Indonesia Golden Vision 2045, providing a comprehensive framework to transform the nation's healthcare system. This law, reinforced by Government Regulation Number 228 in 2024, upholds the 6 pillars of health transformation, focusing on improving the accessibility, quality, and efficiency of healthcare services across the country. Achieving the full potential of these reforms requires active collaboration between government bodies and communities, also the academics, ensuring that the transformation aligns with and address the actual need of the people. Next slide, please. Next slide, please. I want to introduce you. Yeah, please. I want to introduce you of the pillar of health transformation in Indonesia. Next slide. Yeah, thank you. This is an overview of the pillars of health transformation in Indonesia. I think many of you have seen this framework before. There are 6 pillars which serve as the foundation for the Ministry of Health efforts to strengthen the national health system. However, I would like to shortly brief this description to sharpen the focus on our discussion today. The Ministry of Health is committed to implementing a health system transformation that encompasses 6 main pillars. The first one is primary care transformation. Excuse me. The second one is referral service transformation. The third is health system resilience transformation. Number 4 is health financing transformation. The 5th is health human resources transformation. And the last one is health technology transformation. Center for Health Resilience and Health Resource Policy. Back the slide before, please. Center for Health Resilience and Health Resource Policy is responsible mainly for supporting the 3rd and 6th pillars, which is in the red brackets, which are health system resilience and health human resources transformation. For health system resilience transformation, the objective is to prepare for another outbreaks, epidemics, public health emergency, which we all pray is not will coming to Indonesia, through strengthening pharmaceutical and medical devices to become self-reliant, strengthening adequate community and laboratory-based surveillance, and strengthening of disaster and health emergency response system. And for the 5th pillar, health human resource transformation, is to ensure the availability and equitability distribution of the number, type, and capacity of health human resource. Next slide, please. This is the main task and function of Center for Health Resilience and Health Resource Policy. The main task is to perform analysis, formulation of recommendation, and policy evaluation in the field of health system resilience and health resources. And the functions are formulating technical policies to strengthen policies in the field of health system resilience and health resources, conducting analysis and formulating policy recommendation in the field of health system resilience and health resources, conducting dissemination and advocacy of policy recommendation in the field of health system resilience and health resources, implementing policy integration and synergy in the field of health system resilience and health resources, monitoring, evaluation, and reporting, and the last one is carrying out the administrative affair of the policy center. Next slide, please. We start with the health human resources. Current challenge for health human resources, as we know, there are shortage of medical and health workers in healthcare facilities. Recent data, 5.38% of puskesmas or primary healthcare centers, which around 561 puskesmas, it's a significant number for puskesmas are still operating without the presence of doctor, which is critical for providing basic health services. The availability of medical and healthcare personnel in Indonesia still falls short of the national strategic target for 2024, which aim to ensure that 100% of puskesmas are staffed with doctors. 83% of puskesmas have the full complement of 9 essential types of healthcare workers or tenaga kesehatan or nakes. And 90% of hospitals have the required 7 basic and supporting medical specialists. More than 1/3 puskesmas, which is 4,341 facilities, are still incomplete in the terms of 9 essential types of healthcare workers. The 9 essential types of nakes are doctors, nurses, midwives, dentists, pharmacists, nutritionists, sanitarians, laboratory technicians, and public health care workers. This significant gap in staffing affect the ability of many puskesmas to deliver comprehensive and quality primary health services to the population. Around 1/3 hospital, which is 248 units, still lack the full complement of the 7 basic and supporting medical specialists. The 7 basic and supporting medical specialists are internists, pediatrician, surgeon, obstetric and gynecology, anesthesiology, clinical pathologists, and radiologists. Next slide, please. Fulfillment of medical and health workforce in Indonesia, most regions are still struggling to meet the required number of medical and healthcare personnel. Only a few provinces have surpassed the sufficiency targets both at the primary healthcare center and hospital level. The most difficult position to fill at puskesmas are dentists, environmental sanitation specialists, and medical laboratory technologies. Meanwhile, the medical specialties that are most lacking include clinical pathologists, radiologists, and anesthesiologists. Next slide, please. Ladies and gentlemen, today we face significant challenges in meeting the demand for healthcare professionals and services across Indonesia. One major challenge is the uneven distribution of medical personnel and healthcare facilities. This issue is exacerbated by various factors, including weak oversight of practice licensing and limited commitment to redistributing personnel effectively. Furthermore, geographical and security obstacles hinder our ability to rotate staff to underserved regions, leading to disparities in healthcare access across different areas. Beyond distribution challenge, regulatory and policy barriers complete our recruitment effort. For example, there are strict limitations on hiring non-civil servant staff and rigid salary allocation requirements capped at 30%. This regulation creates an inflexible framework that restricts our ability to attract talent to underserved areas, particularly in regions not designated in independent public service entities, or this is the non-BLUD areas. Additionally, we are confronted with low retention rates among healthcare personnel. Many professionals find it challenging to adapt to remote areas due to high transportation costs and inadequate facilities. Furthermore, the lack of career advancement opportunities often leads to high turnover, especially among female personnel who may prioritize family considering when rotating. Other obstacles compound our workforce challenge, including unappealing working conditions in certain areas that deter applicants. Low graduation rate from specific regions add to the problem, as does the fact that many qualified healthcare professionals are working outside the healthcare sector or in non-healthcare institutions. Addressing these multifaceted challenges is essential to strengthening our health resilience. Collective effort from all stakeholders, including government agencies, educational institutions, or university, and the healthcare community are necessary to create a more equitable and efficient healthcare workforce. Next slide, please. Health resilience fundamentally refers to our ability to comprehensively prepare for response and recover from health-related challenges. To address these challenges in the health sector, the Ministry of Health is currently drafting a regulation known as the Minister of Health Regulation on Health Human Resource Management. This regulation is derived from Law Number 17 of 2023 and Government Regulation Number 28 of 2024. It will cover all aspects of health resource management, including planning, procurement, utilization, quality improvement, welfare development, and supervision. As highlighted in the draft regulation on health human resource management, effective planning and procurement are essential components of building a resilient healthcare system. This involves not only strategic resource allocation, but also ensuring that we have the right personnel to meet the demands of our healthcare system. Additionally, the utilization of health human resources must be optimized through quality improvement initiative. This means we must continuously assess and enhance the competencies of healthcare workers, ensuring they are well equipped to deliver high quality care. Training and skill development are crucial as they directly impact the effectiveness of our healthcare services. Furthermore, the welfare of healthcare personnel cannot be overloaded. The welfare of healthcare personnel cannot be overlooked. Providing income security, support for healthcare facilities, and legal protection is essential to maintaining a motivated and effective workforce. When healthcare workers feel valued and safe, they are more likely to perform at their best, ultimately benefiting public health. The establishment of this regulation will ensure that our healthcare system remains resilient and capable of addressing future challenges. Next slide, please. Okay, next slide. Now we move to resilience of pharmaceutical and medical devices. This is one of the crucial things to increase public health resilience also. Learning from COVID-19, learning from the COVID-19 case, various steps are needed to support the independence of pharmaceutical and medical devices in order to produce safe, high quality, and affordable product for the community. Factor that, next slide, please. Factor that hinder the growth of the pharmaceutical industry can vary depending on the economic condition, regulation, and market challenges in a country. Here are some common factors that often hinder the growth of the pharmaceutical industry, including in Indonesia. And next slide, please.
Maybe Dr. Ira have unstable connection.
Okay. Yeah, sorry. Yeah. Okay. Yeah. So, this is the 11th slide, yeah? Sorry. Okay. So here are some of so the common factor that often hinder the growth of the pharmaceutical industry, including in Indonesia, dependence on imported raw materials. Can you back to the before slide, please? Yeah. Okay. Before this one. Oh, which one is this? This one, right? Okay. Okay. Thank you. Yeah. Okay. Thank you. Sorry. Yeah. Okay. This is the factor that hinder the growth of the pharmaceutical industry, can vary depending on the economic condition, regulation, and market challenges in a country. Here are some common factors that often hinder the growth of the pharmaceutical industry, including in Indonesia. Dependence of imported raw materials. Many countries, including Indonesia, still rely on importing raw material for drugs. Fluctuations in raw material prices and dependence on other countries can affect production costs and supply resilience. Limited innovation and high R&D costs. Developing new drugs requires significant research and development R&D, which involve high costs and a risk of failure. The lack of investment in local research and innovation can hinder the growth of the pharmaceutical industry. Lack of access to modern technology. The use of advanced technology in the pharmaceutical production process is often not fully adopted by a local pharmaceutical company. Limited access to modern technology can reduce the competitiveness of the local industry. Next slide, please. An overview of the support for the medical equipment industry can be seen in the following landscape. Indonesia has many medical devices that already have product license number that can support health services, but most of them are still dominated by imported products. The challenges still being faced in the development of the medical device industry is connecting industry with educational institutions, university, vocational schools, research institution, BRAIN, for the development of medical devices, and research funding is still low. Next slide, please. Ministry of Health has drawn up a roadmap of independence for pharmaceutical, medical devices, and emergency response from 2022 to 2025. As seen on the slide, for vaccine, drugs, medical devices, and emergency response. Next slide, please. Resilience of pharmaceutical supplies and medical device is a condition where the need for pharmaceutical preparations and medical devices are met for the country as well as individual, which is reflected in the availability of pharmaceutical supplies and medical devices that meet the requirement for health services in every condition, including health emergencies. This is the concept of pharmaceutical and medical devices resilience. Next slide, please. This is the strategy to promote pharmaceutical and medical device resilience. Ministry of Health has strategy to promote pharmaceutical and medical devices resilience, including research and development, production, and market guarantee. Research development strategies mean developing of R&D task force, transfer technology, enhancing clinical trial ecosystem, and change source facilitation. Production strategies means intervention and facilitating of pharmaceutical industry, such as incentive and disincentive intervention, simplification of licensing product, and facilitate testing and calibration. Market guarantee means provide market guarantee through import product substitution, implementation of local content requirement, and implementation of increasing the use of domestic products. Next slide, please. Priority activities development and downstreaming of medicine raw materials. First is facilitation of chains, source of drugs raw materials. Second is trade management of import of raw materials for medicine. Third is facilitation of cooperation with overseas partners. And the fourth is compilation and review of pharmaceutical security regulation. Next slide, please. The medical device industry development effort needs innovation and research development, multi-sectoral collaboration, strengthening infrastructure and regulation, education and training, and increased market access. So you can see where is the university can be part and join with collaboration with the Ministry of Health. Next slide, please. Strategies conducted by Center for Health Resilience and Resource Policy for this is conducting studies on policy recommendation related to pharmaceutical and medical device resilience, and Center for Health Resilience and Resources Policy help oversee the drafting of the Minister of Health Regulation on medical supplies, which still on process. Next slide, please. The summary in the Ministry of Health, together with ministers and agencies and industry, collaborate to ensure the availability, distribution, and affordability of safe, efficacious, and quality medicine and medical devices for health service needs. The transformation of the health system as an effort to create better, more equitable, and quality health services for all Indonesian people, and the ratification of Law Number 17 of 2023 is the main driver for the development of Indonesia health architecture. And Law Number 17 concerning health provides special space for the regulation of pharmaceutical and medical device resilience as an effort to encourage the creation of health resilience through effort made by the government to increase pharmaceutical and medical device resilience. Ladies and gentlemen, that is a short story of the health resilience. I hope it will bring benefit and enlighten your knowledge. Thank you. I will end my presentation here. Thank you.
Thank you, Dr. Ira Cyndira, for delivering such a wonderful topic for us. It was very useful to hear that your explanation. From the presentation, I make the small conclusion that resilience is a way for a person to be able to improve their health, including by being mentally healthy. Resilience allow individuals to stay focused on the problem and hand without dissolving into negative feelings. Thank you for joining with us, Dr. Ira Cyndira. I hope you have a great day. In this
Thank you
session,
again. I'm sorry I have to leave. Okay, bye.
Okay. Thank you very much. In this session, we don't have a discussion session. So this is the end of the last session in the morning part. Thank you for our three speakers. That was insightful. I would say high appreciation to all the speakers. Ladies and gentlemen, that's the end of our morning session with three wonderful speakers. I hope this event increase our knowledge and brings many advantages to us. As a moderator, I sincerely apologize if there are any shortcomings. And to all the participants, thank you very much for being a wonderful participant during this session. Hopefully to see you again. I'm Mas Tauta Soit. Thank you very much. I'll hand it over to Miss Rosita as Master of Ceremony. Bye.
Thank you, Mrs. Masta, for bringing us to a very productive session today. Ladies and gentlemen, now we have to come to our break session. Please return to your seat at 1 p.m. Thank you.
Recording stopped.
Kepada seluruh panitia yang ada di ruangan ini, tolong untuk menuju keluar untuk sesi. Ladies and gentlemen, welcome back to our webinar session. For all the participants, please open your LSM account and make sure the account active during this webinar session. Now, we have to come to our next presentation that will be led by our moderator, Apotheker Lutfi Hidianing Tias, Magister of Clinical Pharmacy. Ladies and gentlemen, allow me to read her short bio. Mrs. Lutfi graduated in clinical pharmacy in Universitas Airlangga. Now, please welcome our moderator, Mrs. Lutfi Hidianing Tias.
Thank you, Mrs. Rosita. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Thank you for joining us again in the afternoon session of our conference today. I'm Lutfi Hidianing Tias, the moderator for the two conference speakers this afternoon. We will discuss about pharmacy resilience in the era of global health issues. Today, we will explore how pharmacies can adapt, innovate, and thrive in the face of this global health issue. We have an exciting lineup from Indonesia and UK speakers who will share their insights and strategies. Without further ado, let's get started. Please join me in welcoming our first speaker, Mrs. Nikan. Hello, Mrs. Nikan.
Hello, good afternoon, Bu Lutfi.
Okay. How are you today?
I'm a little bit nervous.
Okay, it's okay. Mrs. Nikan, before we begin, I ask for permission to read your curriculum vitae. Okay. Ladies and gentlemen, Apotheker Nikan Sati, Magister of Science, is one of our proud lecturers in the Bachelor of Pharmacy program at Universitas Jenderal Ahmad Yani, Yogyakarta. She obtained her master's degree from Universitas Setiabudi in 2010. Some of her latest publications, as on the screen, with her research area include pharmacy management system and digital transformation in the pharmacy field. On this occasion, Mrs. Nikan will provide valuable perspective on strategy to face the challenges of pharmacies in the future through digital transformation. Mrs. Nikan will highlight how digital technology can enhance our service and improve patient outcome. To participate, if you have any question, please raise your hand or write the question in the Zoom chat column or YouTube channel. Question will be discussed during the question and answer session. Mrs. Nikan, you have 3 minutes for your presentation, and then we will continue with a question and answer session for 15 minutes. Can we start now?
Yes, good.
Okay, Mrs. Nikan, time is yours.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Thank you for having me here today. In this session, we will talk about digital transformation in pharmacy as a part of strategies for future resilience. As we know, technology is continuously advancing, and with the presence of digital tools based on artificial intelligence and data science, We can work more efficiently and safely. I hope this session provides you insight on how digital transformation can strengthen the field of pharmacy for more resilient future. We cannot deny that technology brings positive impact to our lives. Digital transformation in pharmacy means using digital tools like AI, artificial intelligence, big data, IoT, Internet of Things, and cloud computing, and to make pharmacy operation more efficient, improve patient care, and build stronger healthcare system. It helps modernize pharmacy practice to better handle future challenges. There are several aspects of the importance of digital transformation in facing future change and challenges that need to be considered. The first is increased operational efficiency. It refers to an organization's ability to streamline business processes, reduce costs, and enhance productivity. Digital transformation enable the integration of new technologies such as automation and data analytics, which can accelerate processes, minimize manual errors, and provide better insight for decision making. Number two is enhanced patient care quality. Enhanced patient care quality as a core benefit of digital transformation in addressing future change and challenges emphasizes the potential to improve patient outcome, personalized care, and streamline healthcare delivery. The technology like AI and big data enable personalized treatments, remote health monitoring, and more accurate clinical decision. The important thing, number three, is adaptation to market change. Digital transformation helps pharmacists and the pharmaceutical industry become more adaptable to changing demands and new technological innovation. Number four is resilience in crisis. Integrated digital systems allow operation to continue during crises such as pandemics by facilitating remote service and improving supply chain management. And the last is improve security and accountability. It is refers to enhanced data protection, transparency, and regulatory compliance. Through the adaptation of digital technologies, organizations can strengthen their security system and ensure that all processes are monitored and traceable, creating a safer and more accountable environment. There are key pillars of digital transformation, which is these key pillars are the main areas that guide and strengthen an organization shift to digital. This key pillar help us technology to improve how things work, make customer experience better, and reach business goals. Each pillar is a crucial part of changing traditional ways of working into their digital focus networks. The first is technology integration. Yeah. This key pillar is about using advanced digital technologies such as cloud computing, AI, machine learning, and automation within an organization process and system. The purpose of technology integration is to update infrastructure and then simplify operation and introduce new capabilities that enhance efficiency and innovation. In other words, it means technology integration, modernizing the way work is done using the latest technology to make tasks faster, easier, and more innovative. The second is data management and analytics. This key pillar is about gathering data, storing, and analyzing data to gain useful insight and support data-driven decision making. The purpose of data management and analytics is to use big data, data analytics, and business intelligence tools to understand customer behavior and then improve processes and predict trend. So these key pillars means using data to understand what customer want, make work processes better, and spot future trends, allowing for more accurate decision making. Number 3 is customer experience enhancement. This pillar is about using digital tools and platform to improve the interaction and experiences customer have with organization. The purpose is to create personalized and then smooth and engaging experiences that meet customer expectation and build loyalty. In this key pillar means using technology to make customer experiences better and then easier and more enjoyable, so they feel satisfied and want to continue doing business with the organization. Number 4 of key pillar is operational efficiency. This pillar is about using technologies to improve internal process, boost productivity, and lower operational expenses. And the purpose of this key pillar is to automate repetitive tasks, streamline workflows, and increase overall efficiency in business operation. This pillar means using technology to make internal tasks faster, easier, and more cost effective, and then hopefully it can help in the business run more smoothly. And then number 5 of key pillar is innovation and agility. This key pillar is creating a culture of innovation and agility by adopting digital tools and practices that enable quick adaptation to changes and new opportunities. The purpose is to remain competitive in rapidly evolving market and quickly respond to emerging trend and customer need. And this key pillar means fostering an environment that encourages creativity and the ability to adapt quickly, so the business stays relevant and can respond to market changes and customer demand swiftly. Number 6 of key pillar is cybersecurity and data privacy. This key pillar is about implementing strong security measures to protect digital asset, data, and system for cyber threats, while ensuring compliance with data privacy regulation. The purpose is to protect sensitive information, maintain trust, and prevent data breaches and other security incidents. This key pillar means making sure that data and system are safe from threats that could damage or steal important information, and ensuring the organization follow the rules regarding data privacy. And the last of key pillars, number 7, is change management and culture. This key pillar is managing the human side of digital transformation, including preparing employees for changes, fostering a digital culture, and ensuring effective communication. The purpose of this key pillar is to ensure the successful adoption of digital technologies and practices by addressing resistance and promoting a culture of continuous improvement. So the means of these key pillars is helping employees adjust to the change brought by digital transformation, overcoming challenges in accepting new technologies, and creating a culture that supports ongoing progress and improvement. Now we will talk about the current state of digital pharmacy. The current state of digital pharmacy is marked by the increasing adoption of technology to improve patient care and then streamline pharmacy operation and enhance medication management. Here are some digital pharmacy implementation that currently exist. The first is telemedicine. Yeah. Telemedicine involves using communication technology to provide healthcare service from a distance, enabling patients to connect with healthcare professionals without needing to be physically present in a clinic or hospital. Telemedicine plays a crucial role, yeah, especially during the COVID-19 pandemic, by allowing a patient to access healthcare services while minimizing the risk of exposure. Through telemedicine, a patient can consult the doctor and then receive medical advice and manage ongoing treatment from the safety of their homes. This approach has been essential in reducing crowding in hospitals and clinics, and then conserving medical resources and protecting both patient and healthcare providers from potential infection. Telemedicine has proven to be a valuable tool for maintaining healthcare access during periods of lockdown and social distancing, highlighting its importance in modern healthcare system. Next is e-prescribing. E-prescribing is the method of electronically transmitting medication prescription from doctor to pharmacist, eliminating the need for paper prescription. In the context of its current use, e-prescribing is highly relevant to Satu Sehat. Yeah. Satu Sehat is an integrated health information system in Indonesia. Satu Sehat aims to connect various health information systems across Indonesia, including hospital, clinics, pharmacies, and other health facilities into one coordinated network. E-prescribing is an essential part of this system as it allows for the electronic transmission of prescription more efficiently, accurately, and securely through the national health platform. Next is digital medication management. It is refers to the use of technology to track, to control, to assess patient in taking their medication properly. One of them, yeah, for example, is medication adherence apps. This digital apps is for patient provide reminders and then alerts and adherence tracking, and then promoting proper medication use. Some apps share adherence data with healthcare providers, allowing for timely intervention if needed. And in this example apps, patient can enter the medication name and then usage instruction according to what they are taking. Okay, now we'll talk about implementing strategies for future resilience. Integration of AI in pharmacy can enhance efficiency, accuracy, and effectiveness across various operational and clinical aspects. Here are some applications of AI in pharmacy. In area of medication optimization and therapy adjustment, for example, AI can use for precision medicine. It can analyze patient data such as genetic information, medical history, and lab result, and to create treatment plans statistically tailored to each patient unique characteristic. It makes treatment more effective and reduce rate effect. And for we can use AI to real-time data analysis. AI can track patient response to treatment instantly, and then offering automated suggestion for adjusting dosage based on patient's changing condition. And then in area of inventory management and supply chain, AI can use for demand forecasting. AI can examine past data and trends, and then it can use to anticipate future medication needs, allowing pharmacies and drug manufacturers to manage inventory more effectively and prevent stock shortage and surplus. In this area, AI also can improve supply chain efficiency by tracking raw material availability and then detecting possible disruption and offering automated solution to ensure a continuous supply. Next, in area of drug development and research. In this area, AI can be used as a drug discovery. AI can speed up the drug discovery process by quickly analyzing millions of chemical compounds to find most effective candidates for specific disease. And AI helps lower the time and costs involved in research and development. In clinical trials, AI can help design and manage clinical trials by forecasting results, selecting appropriate patient groups, and speeding up the analysis of trial data. In the area of error detection and drug safety monitoring, AI can use for error detection in dispensing. AI can check prescription and identify possible mistakes in the dispensing process, such as dangerous drug interaction, incorrect dosage, or complete mutation allergies. In pharmacovigilance, AI can examine post-marketing data to identify unforeseen drug side effect or safety concern after drugs are available in market. And the last is in area of patient service automation. As a virtual assistant and chatbots, AI-powered virtual assistants can be used in customer service to provide information about medication, dosage reminders, basic consultant support. Yeah. This improves access to pharmacy services, particularly outside of regular business hours. And then, of course, as telepharmacy support, AI can support pharmacists by facilitating virtual consultation with a patient and offering data-driven recommendation. And now we move to how building a future-proof workforce. Human resource in a pharmacy is the key to facing the future of digital pharmacy. Here are some important aspects to consider. The first is upskilling and reskilling pharmacists. It refers to the process of equipping pharmacists with new skills and knowledge to adapt to the evolving healthcare landscape and the increasing role of technology in the pharmacy sector. Both upskilling and reskilling are essential to build to workforce that resilient, adaptable, and capable to leveraging the latest advancement in healthcare and technology. This enables pharmacy to continue delivering high-quality care, even as the pharmacy profession and patient needs change over the time. And the second one is collaborative workflows. It is referred to creating systems and processes where professionals work together across different roles and departments to achieve common goals. So then, by fostering collaborative workflows, the workforce can be more resilient and prepared to handle future challenges, ensuring high quality, patient-centered care that adapts to technological advancement and changing the healthcare demands. Okay, this is the end of the slide. We will briefly discuss the challenges and risks. There are several challenges and risks that may be encountered. First is cost. The cost will associate with technology adoption include the purchase, installation, and maintenance of new hardware and software, as well as training for staff. Organizations often face significant upfront cost to acquire advanced technology and ensure its proper implementation. Poor implementation or failure to achieve the expected return on investment can lead to financial losses for the organization. The second is resistance to change. Resistance to change may occur when employees or management are reluctant or slow to accept new technology or digital transformation processes. Employees may feel they lack the necessary skill or fear that new technology will replace their job, leading or rejection or anxiety. Technology adoption often alter a long-established workflow, requiring significant adoption from employees, which can provoke resistance. If resistance is not managed effectively, technology adoption may be hindered, resulting in a failed digital transformation and a loss of competitive advantage. Number 3 is infrastructure needs. The infrastructure need is need to support new technology, includes network, hardware, software, and security system capable of handling modern technology. Organization may not have the necessary infrastructure to support new technology, such as sufficient bandwidth, servers, or cybersecurity measures. Failure to establish the right infrastructure can lead to delays or disruption in technology implementation, as well as heightened security risks. And the last is potential cyber attacks. Cyber attacks are effort by cyber criminals to infiltrate technology-based security system with the intent to access, harm, or still confidential information. Okay, the last is I want to say that AI or artificial intelligence can be a powerful support tool in digital pharmacy, assisting with analytical and administrative tasks. But it still requires human wisdom and decision making to deliver high quality, patient-centered healthcare. Thus, AI in digital pharmacy is a component, not a replacement for the human role. Okay, that's all for me. Thank you.
Okay, thank you, Mrs. Nikan, for your insightful and wonderful presentation. Ladies and gentlemen, now it's time for the question and answer session. Mrs. Nikan, We have already had a question from chat column. The first one is coming from Dwi Laras. Ask about, can you more explain about upskilling and reskilling pharmacists in building a future-proof workforce? Okay, maybe you can directly answer or respond.
Baik Bu Lutfi. Okay, the first question is from Dwi Larasati.
Okay, yes.
Upskilling and reskilling. Upskilling involves enhancing the existing skills for pharmacists, particularly in areas like technology, digital health tools, AI, and patient care. So this allows pharmacists to perform their current roles more effectively and adapt to change in the industry. About the reskilling is focused on teaching pharmacists new skills that may be entirely different from their current expertise. For example, learning how to manage telepharmacy services, use advanced data analytics, or become expert in digital health platforms.
Okay, thank you, Mrs. Nikan. And the next, I will read the second one. Is from Aska. Ask about some example of the current state of digitalization in pharmacy have already been explained. Are there other examples of implementation that have been carried out, particularly in digital medication management? Okay.
Okay.
Please, Nikan.
Of course, there was some examples of current state of digitalization in pharmacy have already been explained. For example, electronic medication administration records. The system record medication administration digitally and in real time, ensuring accuracy and reducing errors. These apps helps healthcare providers verify that the right dose reach the right patient at the correct time. The other example is clinical decision support system for medication safety. This system integrated with electronic health records and provides alerts for potential drug interaction, potential allergies, duplicate therapies, so that these apps can help pharmacists and healthcare providers in making safer prescribing and dispensing decisions.
Okay, thank you, Mrs. Nikan. And then I will read the next question. This is from Diana. Ask about, why is cybersecurity one of the pillars of digital transformation, and what is called risk arise if it is not taken into account? Okay, please your response.
Yes, cybersecurity. Yeah, cybersecurity is a critical pillar in digital transformation because it safeguards the digital infrastructure, data, and systems that are essential for successful transformation digital. Yeah. If cybersecurity is not prioritized, there are several risks can emerge. For example, data breaches, sensitive data such as patient health records or Financial information can be exposed, leading to privacy violations, legal consequence, and loss of trust. The other risk, for example, is cyber attack, yeah, or maybe risk of from financial loss, and etc.
Okay.
That's all.
Okay, thank you very much, Mrs. Nikan. But we still have another question. Yeah, please be patient. Okay. The next question this is from Olive. The question is, what should we be cautioned about regarding digital transformation in this field of pharmacy?
Okay. Sorry, thank you. In the digital transformation of pharmacy, there are several key areas required question. Number one is data privacy and security. Data privacy and security. With increased digitalization, sensitive patient data is more vulnerable to cyber threat. So strong cybersecurity measures are essential to protect personal health information from breaches. The other is about interoperability. Different digital systems must be able to communicate and share information effectively. If there are poor interoperability, there can lead to errors, inefficient, and data silos, impacting patient care. And but the cost of implementation, yeah, digital transformation can be expensive, and not all organizations may have the resources to adopt the latest technology. So it needs careful planning to manage costs and ensure that investment are sustainability.
Okay, thank you. And then for next question, this is from Afrizal. The question is, what should be done when human resources are unable to keep up with the digital transformation in pharmacy at their workplace? Okay, please your response, Mrs. Nikan.
If human resources are unable to keep up with digital transformation in pharmacy at their workplace, when human resources are unable, maybe there are several actions can be taken. First is provide targeted training programs. Yeah, so maybe the organization will have a training session focused on developing the necessary digital skills, ensuring employees understand and feel comfortable using new technologies. And then the second, maybe the organization can implement upskilling and reskilling. And next is maybe the organization can promote a supportive culture.
Okay, thank you, Mrs. Nikan. And the last question, this is from Salina. Ask about digital transformation currently done to utilities artificial intelligence. Can it replace the role of human? How your opinion?
Yes, okay. Artificial intelligence, of course, is not likely to fully replace human roles, yeah, especially in complex fields like in a pharmacy. AI just can enhance processes by automating repetitive tasks and then analyzing large data set quickly and providing decision support. But it lacks the human qualities essential for patient-centered care. So, in summary, while AI can improve efficiency and support decision making, it complements rather than replace human roles. These pharmacies remaining essential in delivering personalized, compassionate, and effective patient care.
Okay, thank you very much for your answer, Mrs. Nikan. That's very insightful for us. I think the time is up for this Q&A session. Due to time constraint, we apologize for any unanswered question. Mrs. Nikan, thank you for your presentation and discussion with all of us. We greatly appreciate your expertise and the valuable information you have shared. It was a great helping you us today. Once again, thank you very much and see you. Ladies and gentlemen, please give applause to Mrs. Nikan.
Thank you.
Okay. Okay, ladies and gentlemen, from Mrs. Nikan presentation, we learned that adopting digital technology is essential for future resilience and enhancing efficient and patient care. Collaboration and data interoperability are key to addressing the evolving needs to healthcare. Let's embrace innovation to create more effective and patient-centered pharmacy landscape. Ladies and gentlemen, before we move on to next speakers, we will take a break for 15 minutes. During break time, our sponsor from Obat Apps will presentation about their product. Hello, Mr. Jalmas.
Hello, everyone. Hello, good afternoon, Mrs. Mastering of Ceremony. How are you today?
I'm fine. How about you?
Yes, I'm fine, and today is very hot in here, but it's okay.
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 Okay, Mrs. Damas, this time is yours.
Okay, thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. This afternoon, I will explain about my innovation, our innovation, talk about education. Wait, I will share my presentation. Okay. Let me introduce myself. My name is Damas Raja. I'm a pharmacist, and we are nothing more than young people who are trying to innovate and providing benefits of the world of education. Specifically, we talk about pharmacist education. Permission from you, maybe in this forum, too much of lecture and other pharmacists or doctor or other participants. So this afternoon, I just want to share about my product, about my company, talk about technology, specifically in healthcare tech solution. The name of our company is PharmaClick. PharmaClick, we have the vision end-to-end healthcare tech solution. So we have the dreams to can transforming healthcare ecosystem. And now we must to talk about specifically in education. Uh, Education is a very important element. This is very foundation of how the world can works. We talk about access and equity in education is the main key of the progress of civilization. So that's why this afternoon I will explain about the innovation in education, specifically in pharmacist education. We just want to convey we have the technological innovation in the world of education, especially in learning, namely Obat Apps. With yeah, Obat Apps. This application has become an official partner of the Education Association in Indonesia. Name is APTFE or APDFE, and we get 100,000 more than students have access in this application. Too much of feature in this application is solve much of problem, says journey, and then try out and quiz and many more. But the important thing in this forum, I want to tell you about this application or this business is talk about support. Second, talking about the campus, where there are lectures, we often providing let's training, mobility, lecture exchange, and then research, business incubators, scholarship program, and many more. This program is script to increase talk about quality and quantity in campus. So we want to solve much of problem in education process. So that's why we need to present this to our participant, to all. Maybe next time we can get or use this program. And the last of my presentation, to all participants in the work of pharmaceutical, we also open about opportunity as little as possible to all participants, because today we are engaged in various sector, including start from retail pharmacies and then distributor and then cosmetic and anything talk about healthcare and pharmaceutical. So once again, thanks for the attention for this afternoon. Once again, let's collaboration. Maybe in this forum, many much of lecture, university or student. We also hope our innovation or our product can be solution talk about the education of pharmacists. Maybe enough I can to share this afternoon, and I'm so interested for this topic. So maybe enough our presentation. Once again, thanks, and I give back to mastering of ceremony. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Mrs. Damas. Okay, ladies and gentlemen, please break up. This is time to break, and we will meet again in 2 o'clock. Thank you.
Yogyakarta adalah kota yang penuh dengan sejarah, budaya, dan semangat kebangsaan. Kota di mana setiap jalan berasa dijahit erat dengan kisah-kisah kepahlawanan dan pengabdian kepada negara. Dan di tengah-tengah gemerlapnya Yogyakarta, terdapat sebuah institusi pendidikan yang mengemban misi besar. Selamat datang di Fakultas Kesehatan Universitas Jenderal Ahmad Yani, sebuah tempat di mana semangat kebangsaan dipelihara dan para pemimpin masa depan kita dibentuk. Di sini, para pendidik bekerja tanpa lelah untuk memastikan bahwa pendidikan yang diberikan sesuai dengan standar tertinggi. Mereka adalah pemimpin yang bijaksana yang membimbing mahasiswa dalam perjalanan mereka mencapai mimpi dan potensi tertinggi mereka. Fakultas Kesehatan Universitas Jenderal Ahmad Yani memiliki 8 program studi unggulan. Program studi keperawatan S1 merupakan program studi yang mempersiapkan mahasiswa untuk menjadi perawat yang berkualitas. Melalui pendidikan ini, mahasiswa akan mempelajari berbagai aspek perawatan kesehatan, termasuk pengetahuan medis, keterampilan klinis, etika, dan manajemen dalam konteks pelayanan kesehatan. Program studi profesi nurse. Program studi ini mengacu pada program profesi keperawatan yang ditujukan bagi individu yang telah memiliki gelar sarjana di bidang lain, tetapi ingin mengejar profesi keperawatan. Program ini biasanya lebih singkat dan fokus pada keterampilan klinis dan persiapan untuk ujian lisensi keperawatan. Program studi kebidanan D3. Program pendidikan kebidanan tingkat diploma D3 mempersiapkan mahasiswa untuk menjadi bidan yang terampil dalam memberikan perawatan kesehatan kepada ibu hamil, melahirkan, dan pasca melahirkan. Mereka juga terlibat dalam perawatan bayi baru lahir. Program studi kebidanan S1 merupakan program studi yang lebih lanjut dalam bidang kebidanan, memberikan pemahaman yang lebih mendalam tentang kehamilan, persalinan, dan perawatan pasca melahirkan. Biasanya program ini memberikan perspektif yang lebih luas dan mendalam dalam kesehatan reproduksi perempuan. Program studi profesi bidan. Program studi ini mengacu pada sertifikasi atau lisensi bidan yang telah menyelesaikan pendidikan dan pelatihan yang diperlukan, serta telah lulus ujian sertifikasi atau lisensi sesuai dengan regulasi nasional. Program studi rekam medis dan informasi kesehatan. Program studi ini membekali mahasiswa dengan pengetahuan dan keterampilan untuk mengelola informasi medis dan kesehatan, termasuk pengumpulan, penyimpanan, analisis, dan penggunaan data kesehatan yang penting untuk pengambilan keputusan klinis dan administratif. Program studi teknologi bank darah. Program studi ini fokus pada pengembangan teknologi terkait pengelolaan dan penggunaan darah dalam konteks pelayanan kesehatan, termasuk proses pengumpulan, penyimpanan, pengujian, dan distribusi darah serta produk darah lainnya. Program studi farmasi. Program studi farmasi mempersiapkan mahasiswa untuk menjadi apoteker yang berkualitas. Mereka mempelajari tentang obat-obatan, dosis, efek samping, interaksi obat, dan cara memberikan informasi dan layanan farmasi kepada pasien. Di sini, kami bangga menyediakan sarana dan prasarana yang memungkinkan mahasiswa untuk meraih potensi terbaik mereka. Ruang kelas kami didesain dengan nyaman untuk menciptakan lingkungan belajar yang inspiratif, dilengkapi dengan teknologi terkini dan fasilitas yang memadai. Setiap kelas mencerminkan standar kualitas tinggi kami dalam pendidikan. Ruang tutorial, tempat di mana diskusi dan interaksi antara dosen dan mahasiswa menjadi inti dari pembelajaran. Ruang tutorial kami dirancang untuk mendukung kolaborasi dan pemahaman mendalam tentang materi pelajaran. Lab terpadu. Lab terpadu kami menyediakan fasilitas lengkap untuk eksperimen dan penelitian lintas disiplin ilmu. Dengan peralatan modern dan ruang yang luas, mahasiswa dapat mengeksplorasi konsep-konsep ilmiah secara praktis. OSCE Center. Di sini, mahasiswa dapat mengasah keterampilan klinis mereka melalui simulasi yang realistis. OSCE Center kami dilengkapi dengan fasilitas terkini untuk mempersiapkan mahasiswa menjadi profesional yang siap berpraktik. Lab komputer. Fasilitas lab komputer kami menyediakan akses ke perangkat keras dan perangkat lunak terbaru. Dengan ruang yang nyaman dan fasilitas lengkap, mahasiswa dapat mengembangkan keterampilan teknologi yang diperlukan di era digital ini. Lab CBT Computer Based Test. Lab ini dirancang khusus untuk ujian berbasis komputer, memungkinkan mahasiswa untuk menguji pemahaman mereka dalam format yang interaktif dan adaptif. Ruang webinar. Kami juga menyediakan ruang webinar yang dilengkapi dengan teknologi mutakhir. Ini memungkinkan kami untuk menyelenggarakan seminar, workshop, dan presentasi online yang interaktif dan informatif. Asrama mahasiswa. Untuk kenyamanan dan kemudahan akses, kami menyediakan asrama mahasiswa yang modern dan aman. Ini adalah tempat yang nyaman bagi mahasiswa untuk tinggal dan berkembang dalam suasana akademis yang mendukung. Perpustakaan. Koleksi perpustakaan kami mencakup berbagai sumber belajar mulai dari buku cetak hingga jurnal elektronik. Ini adalah tempat ideal bagi mahasiswa untuk mengeksplorasi pengetahuan. Student Corner, tempat bertemu, berdiskusi, dan berkolaborasi antar mahasiswa. Student Corner adalah pusat kegiatan sosial dan akademis di kampus kami. Lapangan basket. Untuk menjaga keseimbangan antara belajar dan kesehatan jasmani, kami memiliki lapangan basket standar. Ini adalah tempat yang sempurna bagi mahasiswa untuk melepaskan energi dan menjaga kebugaran fisik. Apotek. Kami juga menyediakan apotek di kampus, memastikan kebutuhan kesehatan masyarakat umum dan mahasiswa terpenuhi dengan baik. Universitas Jenderal Ahmad Yani siap membentuk para Ahmad Yani muda yang nasionalis, patriotik, heroik. Bersama-sama kita akan melangkah maju menuju masa depan yang lebih baik untuk Indonesia yang lebih besar. Mari kita bersama-sama menjadi bagian dari perubahan di Universitas Jenderal Ahmad Yani.
Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta saat ini mengelola 8 program studi. Program studi pendidikan profesi nurse, prodi profesi bidan, prodi keperawatan S1, prodi kebidanan S1, prodi farmasi S1, prodi kebidanan D3, prodi rekam medis dan informasi kesehatan D3, dan prodi teknologi bank darah D3. Ditunjang fasilitas yang lengkap dan terstandar untuk mencapai kompetensi keahlian, serta semua program studi yang telah terakreditasi oleh LAMPTKES. Fakultas Kesehatan Universitas Jenderal Ahmad Yani Yogyakarta siap mendidik dan mempersiapkan para Ahmad Yani muda bidang kesehatan sebagai generasi penerus kejayaan bangsa Indonesia.
Okay, ladies and gentlemen, now we are ready to continue our next session. It is my pleasure to introduce our second speaker from UK. Without further ado, let's get started. Please join me in welcoming our second speaker, Dr. Louis Hughes.
Thank you very much.
Okay.
And I want to say first of all, it's a real pleasure to be here at this inaugural conference, and I hope there are many, many more to come. And I would also like to thank the organisers for their kind invitation for me to join you this afternoon, or this morning for me.
Okay. Hello, Dr. Louis. I'm Lutfi. Nice to meet you.
And you.
Okay. Before we begin, may I ask permission to read your curriculum vitae to the participant? Okay, ladies and gentlemen, Dr. Louis is a senior lecturer at Cardiff University School of Pharmacy and Pharmaceutical Science. She obtained her PhD at the Wells School of Pharmacy, Cardiff University in 2000. Her research area include pharmacy education, pharmacovigilance and drug safety, role of the Welsh language in pharmacy service provision, resilience and well-being, include green prescribing. On this occasion, Dr. Louis will provide valuable perspective on fostering resilience within our profession as pharmacists. To participant, if you have any question, please raise your hand or write the question, and Zoom or YouTube chat column. Question will be discussed during the question and answer session. Dr. Louis, you have 30 minutes for your presentation, and then we will continue with a question and answer section. Can we start now?
Okay.
Okay.
Should I share my screen?
Oh, okay. Okay.
Sorry, 1 second. My computer is asking me if I want to speak Indonesian. Many apologies, but my Indonesian is not very good.
Okay,
so
it's
I need
okay.
to tell my computer. I'm speaking in English. There we go. Okay. So I'm just going to bring up my slides.
No, not yet.
Sorry, it's happened.
Okay, yes, already with this.
Okay, sorry. Okay. So as per the introduction, I was asked to talk today about building a resilient profession and about developing a community of practice around resilience. And so what I'm going to share with you today is some research that myself and my colleagues, as part of that community of practice, have been undertaking, looking at resilience across all levels of the pharmacy profession. So my first starting point, I'm sure you've had lots of different definitions of resilience already in this conference, given the conference theme, is to say, what is resilience? And to me, in my mind, resilience is about being able to adapt and cope when things go wrong, and that ability to bounce back from problems and to carry on positively moving forwards. And lots of research is showing that it's really important to have good resilience. It's a good indicator of positive mental health. It's associated with positive well-being, and it's also associated with a reduced risk of burnout, particularly during times of stress. And resilience is really important, as I say, through all stages of the career. And that's from pharmacy students through to practicing pharmacists. And also resilience in terms of personal resilience, but also in terms of the resilience of the organisations that we work for and with. So I'm going to start by talking about pharmacy students. So pharmacy students are not an entirely unique group, but they're quite a special group in that healthcare students generally tend to experience quite a lot of pressure during their education. The courses that they study are academically challenging, they are difficult, they have to work really hard to do well, and often they have lots of long contact hours compared to perhaps some of their colleagues on other courses. In addition, our students quite often are out in the workplace, working in clinics and hospitals, and they may be exposed to adverse events there. They may see patients who are particularly ill. They may even see patients sometimes who've passed away. They may see patients' relatives who are upset or angry. And so there are lots of things that they may be exposed to which can bring stress to them, and often at quite a young age. And all of these things can lead to a negative impact on their mental health. And certainly we've seen in the UK, and I don't think this is UK specific, that this can often lead to attrition from the course. So students start the course and realise that actually they aren't able to continue because of those stresses and the fact they struggle to overcome those stresses. And yet, despite all of this, there's very little research which has looked at resilience within pharmacy students. And so I'm going to present some data from a paper which is published around 3 years ago, which the reference is on the bottom of the screen there if you want to read more. So our study basically looked to find out about academic resilience amongst pharmacy students across the UK. And this was a survey-based piece of work which looked at students who are undergraduate pharmacy students studying at 3 schools of pharmacy in the UK. And it was a straightforward self-complete questionnaire. In most cases, it was completed on paper. So it was given out in workshops and teaching sessions. The exception was one of the schools, the final year students were not in the building at the time. They were out on placements and projects. And so they completed theirs online. And we used some standard scales which are used within the field of resilience and well-being, and asked some demographic questions. And those scales were the Academic Resilience Scale, the ARS 30, and the Warwick Edinburgh Mental Wellbeing Scale, which is often called the WEMWEBS survey. So WEMWEBS looks at general well-being and is used in all sorts of populations, not just students and not just healthcare. Academic resilience is a scale which was developed by Simon Cassidy at the University of Salford, who developed it to look at the students' ability to continue to do well on their courses despite challenges and adversity. So it's a tailored scale looking specifically at being a student. And we're really fortunate that we had a really good response rate of 73% and a real mix of participants across the sort of the typical demographics, which is kind of what we would expect based on what we knew of our student population. So they were fairly representative of our students. And when we looked at their academic resilience, this gives us a score, which we can then use to compare. And the higher the score, the better the resilience. So when we looked at the academic resilience of our pharmacy students, we found that their score was actually lower than with other student populations, so other non-pharmacy student populations. But we also found from the WEMWEB scores that their WEMWEB score was also lower, indicating poorer well-being. So overall, their mental health was also poorer. But we also found to confirm that, as we would expect from other research, that resilience was a real positive indicator for well-being. If you had high resilience, you had high well-being, and vice versa. So low resilience and low well-being. So these were very much linked together. And we found that resilience, surprisingly, was particularly high in year 1 and then dipped into year 2. So we're not sure of the reasons behind this, but it was clear that the students came in to the university, and perhaps that was linked with their positive well-being at the start of the course, feeling excited, looking forward to their university career. But then due to the pressures of the course during that first year, that led to lower well-being and lower resilience. And it did vary by school. 2 of the schools had slightly higher scores than one of the schools. And again, we're not sure of the reasons behind that. And also by gender. And this was a very small response, but there were a couple of the items on some of the scales whereby males scored slightly higher than female students, but the overall score wasn't affected. And there were no differences on the basis of ethnicity. So having looked at these results, we've recognised that, there is an issue around our students' academic resilience, and that does impact on their well-being. And if we want our students to succeed, we need to make some targeted interventions to support and enhance their resilience. And by supporting them in this and helping them to develop their resilience, we hope that that will increase their ability to do well on the course. It will increase their ability to stay on the course and to not have to feel they have to drop out. And not just their resilience now as students, but by giving them those tools early on in their career at the student stage, we hope that that would be able to give them the tools to use later once they're qualified as pharmacists in their future practice, when they probably experience even more stresses. And so we found this a really helpful baseline to think about where we're starting from in terms of resilience amongst pharmacists by looking at their very early days. I'm now going to move on just to talk a little bit about resilience in practicing pharmacists, because that was our next stage in our research. We thought, we know a little bit about the pharmacy students, but what about pharmacists who are actually out there practicing? So pharmacists worldwide are developing and changing their roles, and this varies from country to country. But certainly in the UK, there are lots of new clinical services being added to pharmacist roles, whichever sector of the profession they work in. And this is a really positive thing, and pharmacists like the ability to take on these more clinical roles. However, this can also lead to increased pressure because of having to complete more challenging roles and complete them alongside other services which they're already offering. And that can lead to pressures in terms of their time, in terms of targets from managers, and all sorts of other perhaps unanticipated pressures. As I've already mentioned, we know that well-being and resilience are linked. We know that well-being if well-being is high and resilience generally is high and vice versa. We also know from research that if your well-being and resilience are low, so if you have poor mental health and don't have the ability to bounce back from stresses, that can lead to burnout, whereby those pressures are overwhelming and that person can't continue with their day-to-day life, or day-to-day working life in this case. And we carried out this piece of work, as it happened, was right at the beginning of the COVID-19 pandemic. And this actually proved to be a really challenging time for pharmacists. And again, I don't know the various roles which pharmacists took on across the globe, but in the UK, there were lots of concerns about pharmacists being the only real health professional that patients had access to at the start of the pandemic. Many other services stopped operating or reduced operation. So patients weren't as able to see their local GP, their doctors, their dentists. They couldn't go into hospital as easily because regular routine treatments were cancelled. And so really the only healthcare professional that patients could access was pharmacists. And our concerns at the time were that these were pharmacists who were already perhaps under some stresses, and suddenly they had a lot more stress piled onto them. And we wanted to know how that impacted on their well-being, their resilience, and their risk of burnout. And the data I'm presenting is published in the 2 papers on the bottom of the screen there again, if you want to see more about it. So in terms of our survey that we carried out, this again was an anonymous online survey. We wanted to make sure that people felt comfortable sharing quite personal information with us. And it was patient-facing pharmacists based in the UK. So they could be working in hospitals, in clinics, in local communities, but they needed to be dealing with patients to participate. And we used a range of convenience sampling and snowball sampling to access pharmacists. So we sent out messages through contacts and asked them to share with other pharmacists. We used social media and we shared things through things like LinkedIn, Facebook, X, to try and get the word out to as many pharmacists as possible. The survey looked at, apart from general demographics, it used the WEMWEBS score I've already mentioned, but the short form of that survey. We also used a scale called the Connor-Davidson Resilience Scale, which measures resilience, and the Oldenburg Burnout Inventory, which, as the name suggests, measures burnout. And we also collected free text comments for people to discuss their sort of views around some of these questions and to expand on their answers. The survey was sent out at 3 separate time points. So early in the pandemic, so obviously the pandemic started really in March. That's when most of the sort of lockdowns and things began across the globe. So we looked at time points in June, in October of that year, and then the following February, so kind of a year after the start of the pandemic. And because we gave every respondent a unique code, it meant we could link responses from the same person in each survey and identify what an individual was saying at those different time points without breaching their confidentiality or anonymity. And what we found was that we got a reasonable number of respondents. Obviously, there are thousands of practicing pharmacists across the UK, but given this was a time where they were already busy and dealing with, their regular roles under pandemic conditions, we managed to get responses from 200 participants. And they were typically, these were from England, so the UK comprises 4 countries, and these were mostly from England, which is the biggest country, which you would expect. They were mostly female, and that's fairly typical for the pharmacy workforce in the UK, although the percentage is slightly higher. And predominantly they work in hospital or community, although some were working in other sectors, and mostly working full-time and mostly employed by other people. So they didn't necessarily work for themselves or own their own pharmacy. And roughly that is similar kind of demographics to what we have from the Register of Pharmacists in the UK. We had hospital pharmacists were slightly overrepresented, but it gives us a rough demographic sense of our participants. So we sent out that survey, as I say, in June, and we had 200 responses. When we asked them at the end of that survey, can we send the survey again at different time points, 145 said yes, and 61% of those took part in survey 2 and 59 in survey 3. And that varied. Some people took part in survey 1 and 3, some in 1, 2, some in 1, 2 and 3. So it was very variable how they responded. And again, that's as you would expect given the circumstances. And our results from using our 3 scores, we assessed their mean scores across the 3 scales. And we also then compared those to general population scores. So we looked at them in pharmacists based on our data, and then we looked at them from other published research, which looked at the wider UK population, so everybody in the UK, regardless of their role or occupation. And we found that well-being, which was using the WEMWEB score, was lower than the UK population. The mean score was about 2 points lower on that scale. The resilience of our pharmacists was also lower than the general population. Again, about 4 points lower in this case. And the risk of burnout, which is assessed using Olby, where it ranks people's, or gives a score around their likelihood of experiencing burnout, we actually found the risk of burnout was quite considerably higher than the general population, around 6 points higher than you would expect, everything else being equal. So we had a population of pharmacists who were really struggling in terms of their mental health. They didn't have the resilience to be able to bounce back from those stresses, and therefore were at increased risk of burnout. And interestingly, we found that the results remained the same over time in terms of burnout risk, and actually their well-being and their resilience decreased. So we anticipated that as the I suppose as people got more used with the pandemic and as some of those restrictions started to relax over time, so over the course of the first year of the pandemic, we anticipated that things would start to improve for pharmacists after that initial high stress period where everything was changing and there were problems everywhere. In actual fact, what we found was that, as I say, they actually weren't doing as well. If anything, their well-being and their resilience were decreasing, and like I said, the risk of burnout didn't improve, which was what we were hoping would happen to them. We also looked at their free text comments as well to find out some of the reasons behind this, and we've found much rich data within that, those survey responses. So the kinds of things people commented on as being stressors for them were things like the high levels of workload, which we knew were considerable. Pharmacists weren't getting breaks. They were having to work extra hours to get through all the work needed. They didn't have access to personal protective equipment, so things like masks and screens. And so they were scared and stressed by the thought that they were putting themselves at high risk of contracting COVID. And also patient attitudes. There was a lot of anger and frustration from patients, and that often came out by patients getting angry with pharmacists and threatening pharmacists, to the point where some pharmacies actually closed the doors and served patients through windows so that they could keep people out of their premises just in case there were any problems. And these were quite extreme cases, but were reported quite widely across the press. Despite all those stresses, there was some positivity around their experiences during the pandemic. And this was linked to the fact that pharmacists were being asked to upskill and develop new roles, and also to use skills they had that perhaps they weren't using normally in their everyday work. So suddenly they were having to do far more diagnosis, they were having to take more responsibility, assessing patients, for example. And they actually enjoyed the challenge of doing that and felt like they were being valued in terms of their skills and abilities that they had. In terms of things which helped or hindered their well-being, organisational factors were a key role. in fact, they were probably the main thing that could make a big difference around how a pharmacist felt during this time. So if the organisation was supportive and had things in place to enable those pharmacists to undertake their roles, that made people's life a lot better, and they had better resilience and well-being. On the other hand, where they weren't being supported by their organisation and where barriers were being put in the way by the organisation, that then increased the pressures on that pharmacist and led to worse well-being, worse resilience, and therefore increased burnout risk. And these were quite significant stressors. So in some cases, pharmacists were either thinking about changing jobs and switching to a different part of pharmacy, or leaving the profession entirely. And indeed, some people actually reported that they already had done that. They'd actually left the profession because of the impact on their mental health of working under such pressures. So in terms of our conclusions from this work, it was very clear to us, and I don't think we appreciated this at the time, that the impacts of stress from a crisis, working in a crisis, that can actually last for quite a long time. It's not a case of the fact that there's a lot of stress in the initial period, but then you get used to it and you are able to adapt to it. Actually, in most cases, that stress continues at the same level or possibly even higher over quite a long period. And so we need to be considering about support which is long lasting and which enables pharmacists to operate at their optimum level moving forward, not just in that initial phase. I should point out there were a minority of respondents who experienced something called bonadaption, whereby actually they deal with that stress and actually improve as a result of the stresses and pressures put on them. And often people talk about people who respond well to stress as being type A personalities, the ones who thrive on stress. There was some evidence that there were people who actually rose to those challenges and like I say, actually improved their mental well-being, but it was very much a minority. Our other key conclusion, as I say, is that organisational resilience plays a huge role. It can be a real threat to pharmacists' well-being and have a real negative impact on that. And if things are not put in place and not done with a view to how to support those pharmacists, informed by the pharmacists, so what do they need and what can we do about it, that can be a real negative impact on them. And obviously any negative impact on pharmacists then passes on to patients, because that's what we're there for, is for our patients. And so if we're not doing well, we can't help our patients as well. However, in some cases, and there were some lovely examples of this, it actually can be a real opportunity to enhance pharmacists' well-being. And we again had people talking about their particular circumstances. Some people had managers or organisations who were really listening to them, really finding out what they needed and then offering that support. And very often this was through colleagues who they were working with every day, but also through higher levels of their organisation. And when they did that, those pharmacists did much better and therefore were able to help their patients better. And I think that's in everyone's interests that we do that. So as I say, those are some findings from some work we've been doing with students and with practicing pharmacists. And all of this is linked to a group called GRIT. And you probably won't have come across this, so I thought it was an opportunity to tell you a little bit about this group. So GRIT stands for Global Resilience Team, and it's a community of practice based around pharmacy workforce resilience. And there, I've put on the slide there a reference to a paper which introduces the group, and also the GRIT website as well, if you wanted to have a look. And the idea was that, recognising that there wasn't much out there in regard to resilience in pharmacy, we set up this interest group, I suppose you could call it, to try and draw together people who were interested and to provide resources for the wider workforce. So back 5 years ago, when we had conferences face-to-face before the pandemic, a group of us were at a pharmacy education conference and talking about resilience amongst pharmacy students. And we had lots of discussions about the challenges we were facing and realised that they were the same whichever country we came from. We were experiencing similar issues. And so after that conference, we all started emailing one another and having some online chats, and came up with the idea of developing this group, this, like I said, this community of practice, with the view that we could learn from each other, we can share work, and we can support one another in terms of understanding and doing research into this particularly important area, which often I think gets under-reported and under-researched. So we work together as a group, and knowing that there are other interested parties who have experience in this area, we can bounce ideas from one another, come up with problem-solving strategies, and also collaborate. And my collaborators on the work I've just presented are based at a range of universities, and we're all members of GRIT, and that's how we kind of got together to undertake that work. And it's not just about research and about us as members, although obviously that's where it stemmed from. As part of our discussions, we realised that there were issues around resilience and wellbeing amongst pharmacists, and that there wasn't a lot of stuff out there that was tailored to support pharmacists who wanted to improve their wellbeing. And so the website, while it does talk about research, also has a number of resources on there which have been developed by members of GRIT. And again, it's just a useful place to go to find out some support resources. So that's there for everybody to access, and to sort of provide feedback as well if there are things that people find useful or things that people don't see on there that they would like more of. So just to draw things to a close, and having gone through that journey myself, I've, like I said, an interest in resilience, and then finding out about what is happening within our students and within our profession, that's really led me to, I suppose, get really interested in this area and want to think about what I can do to try and improve things. And so those are my closing thoughts around what can we do? What can we do as individuals? And I think the first thing we have to remember is that we need to be resilient ourselves to help others. And sometimes we're so busy helping others, particularly as pharmacists and academics, that we forget about ourselves. And so what can we do to improve our own resilience is always the first thing. And if we're resilient and strong, then we can then think about what can we do to help our colleagues and the students we teach. And thinking about, what's happening at present, what are the challenges that are impacting on people's well-being, and what can we do to try and improve that? And again, there are lots and lots of resources out there. There are lots of toolkits and things, but also talking to one another through conferences like this conference today. It's a real opportunity to meet other like-minded people and to bounce some ideas around. But then also thinking beyond the personal, thinking the organisational, think about our workplaces. What things happen that cause challenges for people and can affect well-being, and what things happen that are really positive and can improve well-being, and can we do less of the things that cause problems and more of the things that are solutions and facilitators, and talking to one another to try and improve that. So I'll leave you with those closing thoughts, and thank you for letting me speak to you today.
Okay, thank you, Mrs. Lewis, for your insightful presentation. Now it's time for the question and answer session. We have already a question from chat column. The first question is coming from Arya Dharma. Asked about, could you please explain the relationship between resilience and well-being in practicing pharmacies? Okay.
Of course.
Yes.
So there's lots of research has looked at this generally, and it seems that within fact practicing pharmacists, that relationship is exactly the same. So well-being, if you have high well-being, you generally have high resilience. And the reason, to some degree, we think, and again, we don't know the exact reasons behind it, but we think that basically it works in both directions. So if you have positive well-being, you're more able to deal with things, with problems, because you have a stronger ability to do that. But also it works the other way, in that if you're quite a resilient person, then that in itself gives you good well-being. And it's almost, I suppose, thinking of it like a bank account, that you have so much money in your account, and sometimes you keep taking money out, it drops below that level, and you end up in negative equity. And it's the same with energy and resilience and mental energy, in that if we keep taking it out, we drop below a point where it's quite hard to get back into those strong levels again. And so resilience is finding skills and techniques to try and bring us back up into those higher levels. So we're not sure of the exact cause behind it, but we certainly know that having good resilience can definitely improve your mental well-being for those reasons.
Okay, thank you for your response. And the second one is coming from after Triastuti. The question asked about, I would like to ask about the analysis that you perform on pharmacy student resilience and well-being compared to students from other backgrounds from the published data. How did you measure the effect of confounding factor and avoid bias on your analysis? Data from previous study may be obtained from different setting and methods. So is there any additional analysis that can be used to minimize the bias?
Yes, so my easy answer to this, I will expand, but my easy answer is I got my collaborator, Simon Cassidy, who developed the scale, to do the analysis because he's an expert in this. So I didn't undertake the statistical analysis personally, but you really, it's a really good point that you raise, is when we do research around resilience and well-being, there are so many confounding factors which come into play, and it is very difficult to make those judgments. I think by having these standardized scales, that does help because of the way these are usually quite long question scales, and due to the sort of numbers of questions within there, it gives us a sense of robustness around it. But there are inevitably going to be confounding factors. So my understanding from Simon, and as I say, he's the expert in it, was I think he used regression analysis to try and minimize the effects of some of those confounders. But you're right that other studies that we're comparing with may have taken slightly different things into account, and ultimately there's no way to totally eradicate that confounder bias. But by using these common scales and by testing it in multiple populations, it does give us a sense of confidence around those, the way that we're measuring those things.
Okay, thank you, Louise. And the other question, this is from DCR. My question is, what were some specific activities undertaken by Global Resilience Team to promote resilience?
Okay, so I think, first of all, where we've started from is we started off really as a small group of people with a common interest who wanted to help one another to understand how to do research in this field, so that we knew what the issues were, to then be able to promote and help with resilience more widely. So a lot of our activities have been in relation to collaboration and working together on joint research projects to explore resilience in our various countries. So Dalia, for example, has been looking at resilience in Lebanon, amongst some of the challenges that have been experienced there. We've got members in the USA, in Australia, sort of all over the place. So we've managed to undertake some useful research to give us some answers. We've also developed, as I say, some resources, and I would recommend to have a look at the website. So amongst our members are people with real expertise in this field in terms of psychology, and they've developed some videos and other resources which are available to people to use. members have also presented at a range of conferences and symposia. There have been some talks with the FIP, which have been trying to spread the word around the importance of resilience. So I think we're probably in early stages, quite small steps at the moment, but there's certainly, we're trying to spread the word out from there, and definitely do have a look at the website for some of those.
Okay, thank you. Okay, and the last one is from Nabila Sahida, asks about what strategy have been implemented by Global Resilient Team to address pharmacist burnout.
To be honest, at the moment, Nabila, we haven't actually done anything directly to enhance burnout beyond trying to share some resources about resilience and to try and encourage individuals to work within their organisations that they're working in to try and look for the local problems that they can experience and to give them some tools they can use to try and address that. I think that's our longer term strategy. Obviously, we would love to be able to do that, but at the moment we're probably a little bit too small in scale to really try and address what is a really, really big challenge. So we're starting small by looking at the resilience side of it and the well-being side, and then from that we're hoping that we'll move on to address burnout, given that burnout is linked to poor well-being and poor resilience.
Okay, thank you. I'm sorry, Luis, this is very, very last question from Aina Lina. The question is, what future activities does GRID plan to focus on to strengthen their community of practice?
Again, just going forward, we are meeting up with one another just to try and identify more opportunities. I think our primary focus is to find out some of the answers, because at the moment, we have a lot of gaps in our knowledge and our understanding around resilience and well-being in pharmacists. And so our main activity at the moment is to support and work together to develop more research which we can use to address some of those questions. And by working together, it gives us more strength because we can undertake research across global settings, we can have more expertise, we can share expertise. And so our primary activity really is to develop that research body, which we can then use to inform the activities that Nabila was just asking about in terms of actually being able to produce things which we can use to help pharmacists. So we've got little bits of both at the moment, but we really want to try and understand what the issues are to be able to move forward.
Okay, thank you for all your answer. This was very insightful. I think the time is up for this Q&A session. Due to time constraint, we apologize for any unanswered question. Dear Luis, thank you for your presentation and discussion with all of us. It was great having you with us today. We are grateful for your willingness to engage with us, and we look forward to collaborating again in the future. Once again, thank you very much and see you in next time. Ladies and gentlemen, please give applause for Dr. Luis. Thank you
very much. Enjoy the rest of the conference. Okay. Hope it's very successful.
Okay, thank you. Ladies and gentlemen, thank you all for your attention and participation. I hope you have enjoyed this session and gathered some valuable insight and knowledge from our speakers. Please stay with us because after this, we still have one more speaker who is equally fascinating. Now, I'll turn it back to our MC who will guide us through the next session. Thank you very much. We look forward to seeing you at our next event. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mrs. Lutfi, for bringing us to a very productive session today. Ladies and gentlemen, now we have to come to our poster session. To committee in charge, please show us the poster.
Hello, we meet again in the second presentation of the poster presentation at UNICARE. The first poster is with the title is Reducing the Present Using Herbal Therapy on Elderly in Indonesia. It written by Rizky Wahyudayati, Anastasia Suci Sukmawati, and Yuli Astuti. The objective of the research is to know the effectiveness of CIT or complementary and integrative therapy of the herbal between Saduti, Wedang Ungu, Javanese traditional drink, and aromatic foot-based hydrotherapy on reducing the depression. And the conclusion of this research, based on the result, the aromatherapy foot-based hydrotherapy and the Saduti are effectively decreasing the elderly's depression. However, the aromatic foot-based therapy is the better therapy for decreasing depression in elderly rather than Saduti and Vedanta. The next poster is written by Dwiyati, Latifah Susilawati, and Ratih Kumarajati with the title The Effect of Government's Flashcard Media Education of Readiness to Face Menarche in Elementary School Students in Bantul. And the conclusion of the research is the government's flashcard increases the readiness to face menarche in elementary school students in Bantul. The next research are written by Aidatus Isra Umairah and Alfi Lutfiati with the title The Association Between Family Support and Complements in the Undergoing Antenatal Care in Pregnant Women at Kasihanwan Public Health Center. The purpose of this research to learn the association between family support and complements in the antenatal check-up for the pregnant woman at Kasihanwan Public Health Center. And the conclusion, there is an association between family support and adherence to conducting antenatal check-up on pregnant women at the Puskesmas Kasihanwan with the moderate relationship closeness. And the next research are written by Niputu Rosita Dewinda and Rizky Wahyudayati, and the title is The Experience of Receiving Social Support Among Adolescents with Self-Harm Behavior in the nursing program at Jenderal Ahmad Yani University, Yogyakarta. The objective of the research is to discover the experience of the receiving social support among adolescents with the self-harm behavior in the nursing study program in Jenderal Ahmad Yani University, Yogyakarta. The conclusion of the research is social support is defined as a feeling of being touched by attention and affection because of the support of a good friend. Attention, affection, and support from good friends are meaningful forms of support that can create the deep emotional feeling to help control self-harm behavior. And the next research is written by Raihan Afifah Putriwardani and Rizky Wahyudayati with the title is The association between self-readiness and anxiety level in dealing with minarki in elementary school students in the Donoharjo district. The purpose is to know the association between the level of self-readiness and the level of anxiety in dealing with minarki in elementary school students in the Donoharjo district. The conclusion of this research, there is a perfect and strong association between the association of self-preparedness and the level of anxiety in the face of minarki. This can be said if the readiness is good and the respondent will not be anxious in facing minarki. And the next poster is written by Nurul Hasanah Abdul Rahman and Anastasia Shulti Sukmawati and Suwarno. And the objective of the research is to determine the effect of Cystium aromaticum on uric acid level in the elderly in Ternate. And the conclusion is there is an effect of Cystium aromaticum on uric acid level in the elderly in Ternate. The next research written by Pusparini Anggita Ayunityas, Novia Faiza Fahida, and Satiorini and then Sahirul Alim. The title of the research is Validity, Reliability, and Interpreter Reliability of the Cognitive, Affective, and Psychomotor Instruments for Earthquake Disaster Preparedness for Head-Gatherers. The objective of the research is to assess the accuracy and consistency of the cognitive, affective, and psychomotor instrument in carrying out the earthquake disaster preparedness in health-gatherers. And the conclusion of this research indicate that the cognitive, affective, and psychomotor aspect in carrying out earthquake disaster preparedness are important for health gatherers. Sorry. And the next research written by Nurul Hidayah and Ferianto with the title The Effect of Animation Video Education on the Level of Knowledge of Personal Hygiene in Children at Muhammadiyah Warung Boto Elementary School at Yogyakarta. And the aim of this study is knowing the level of difference before and after being given animated video education on the level of personal hygiene knowledge. And the conclusion, there is an influence of animated video education on the level of personal hygiene knowledge in children at Muhammadiyah Warung Boto Elementary School. The other research is written by Anastasia Suci, Rizky Wahyudayati, and Untoro Dwi Raharjo, with the title is The Effect of the Puzzle Therapy on the Cognitive Status of the Elderly. And the objective is to analyze the effect of puzzle therapy on cognitive status in elderly. And the conclusion is the puzzle therapy has the impact on cognitive status of the elderly. The next research written by Elizabeth Deta Lustiati, Nur Alfira Paskawati, Nugroho Susanto Sumantoro Ebenezer Parlindungan, with the title The Impact of Climate Warming on Rodent Population Dynamic and Leptospirosis Risks in Yogyakarta, Indonesia, an Ecological and biometeorological analysis. And the conclusion, the study revealed increases rat density in several districts of Yogyakarta, exceeding environmental health standard at specific time. Limit-based control measure and cross-sectoral coordination are essential to manage rats population and prevent zoonotic disease spread. The next research is written by Latifah Susilawati with the title is Latifah Susilawati, Duyati, and Emma Walianti. The title is Correlation between Personal Safety Skills and Self-Efficacy in Preventing Sexual Violence Among School-Age Children. And the objective of the research is to investigate the relationship between personal safety skill and self-efficacy in preventing sexual violence among school-age children. And the conclusion is personal safety skills and self-efficacy are strongly correlated in preventing sexual violence among school-age children. It is important to enhance school-age children's understanding of these two aspects. The next research is effect of Burger-Allen exercise on the level of blood glucose. It was written by Putu Aprina Sridevi and Weni Savitri, and the purpose of the study is to identify the effect of Burger-Allen exercise on the level of blood glucose of diabetic patients. And the conclusion of the study, Balloon-Allen exercise can be performed as the part of nursing intervention to control blood glucose in type 2 diabetes mellitus patients. Okay, I think that's all for the presentation. Thank you for your attention and see ya.
Thank you to the committee in charge for showing us the poster. Ladies and gentlemen, now we have come to our next presentation that will be led by our moderator, Nurse Suwarno, Master of Nursing Science. Now, allow me to read his short bio. Mr. Suwarno, expert in family nursing, and got his master's degree in Khon Kaen University, Thailand. Ladies and gentlemen, please welcome our moderator, Mr. Suwarno.
Thank you, Miss Rosita. Good afternoon, everyone. Hello. Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. My name is Warno. You can call me Ano. And hopefully in this last session, you are still good, happy, and also not sleep, yeah. Because this is the last session for our conference today. Okay, without any further ado, please welcome our last speaker, Assistant Professor Dr. Nitaya Pankam. Sawadee-krap, Achan.
Yes, good afternoon, selamat siang.
Good afternoon and selamat siang, Achan Nitaya. How are you today?
Yes, fine. I'm fine. Thank you. And you?
I'm fine too. Nice to meet you again, Achan, in international conference. And last time we met in Khon Kaen University, Thailand.
Okay.
Yeah. Okay. Before she will deliver her presentation today, I would like to read Achan Nitaya curriculum vitae. Achan Nitaya is a lecturer in Department of Midwifery from 2010 in Faculty of Nursing Khon Kaen University, Thailand. And also her position right now in Faculty of Nursing Khon Kaen University, Thailand as Assistant Dean of Technology and Education Quality Assurance. She was graduated in advanced midwifery for magister and doctoral program in Faculty of Nursing, Khon Kaen University, Thailand, and she also has experiences as registered nurse at delivery unit Ramati Body Hospital and postpartum unit at Srinagarin Hospital. As lecturer, she is also contributes in many research and also community services, and all of the article has published in the journal, both of in national, maybe in Thailand country and also in international journal. Her expertise in midwifery, maternal and child health, pregnancy, women health, and breastfeeding. If you would like to collaborate with her, please feel free to contact Achan Nitaya. Is it all right, Achan?
Hopefully, okay.
Yes. Okay, Achan Nitaya will deliver her presentation to us about maternity system in Thailand as long as 30 minutes, Achan. And after that, there is a question and answer session. To Assistant Professor Dr. Nitaya Pangham, could we start your presentation right now?
Yeah.
Okay.
Okay. I will prepare my slide by myself. Okay.
Okay, Achan. To Assistant Professor Dr. Nitaya Pangham, the time is yours.
Okay, thank you so much for your wonderful, suggestion and recommendation for my CV. And again, selamat siang for Indonesia and good afternoon all participants. And that the MC recommend my background a little bit. Actually, okay, again, my name is Dr. Nitya Panyam. Actually, I work in the Faculty of Nursing in the midwifery department. And for today, I think it's like a question for me to share a little bit of my topic of the maternity system in Thailand. As we know that, I think for the topic of maternity or maternal and child health in like a trend or important part, especially in the midwifery part. For our outline today, I try to finish my presentation in 30 minutes. And my outline today, I will demonstrate and share you a little bit for the maternal situation in global and also in Thailand. And after that, the maternity system in Thailand. And as well, another part is midwifery and maternity education in Thailand. And the last one, I will demonstrate a little bit about midwifery and maternity education, especially in the Faculty of Nursing in Khon Kaen University. Yeah, let me start. As we know that the importance of the maternal death, as we know, is like an important indicator for health system. In globally, as we know, currently we will find that the prevalence or incidence of the maternal death, almost 800 women die. The cause is from the preventable cause that related pregnancy and childbirth every day. The data is shown in 20 and 20. And about 287,000 women die, during the pregnancy. And as we know that nearly allows 95% of all maternal death occur in the low or lower middle income country in the world. And the evidence in the global situation, we found that every 2 minutes a maternal death occur, every 2 minutes in globally. And between 2020 and 20 year of the 20 of 20, we found that the MMR is the maternal mortality rate, is not allowed 34 in worldwide. And we will know that the skilled health profession is like, is a crucial role for, prevent or save life of the woman and newborn. That is the important thing. And as we know, the MMR rate is like still behind. Based on the literature review, we found that there are like many causes or many factors that cause of maternal death. The first one, as we know that the severe bleeding, or that we call like a postpartum hemorrhage, is the main cause for the maternal death. And after not only for PPH, we will find that for the another condition such as the high blood pressure, for example, PIS, preeclampsia or eclampsia, is another cause for, like a maternal death. And another thing is the problem of infection related to pregnancy. For example, polioamnionitis is one of the cause of maternal death as well. And for the another factor, we found that the complication for unsafe abortion is the one important cause that lead to the maternal death as well. Another condition that we found from the literature review, there are another important factor, for example, HIV or AIDS and malaria in some, low income country. And among the children under 5 years, we will found that the cause of death is associated with the many factors. The first one is result from the preterm birth, and another one, the complication from the blood trauma or aphasia, such as like a shoulder is dystocia. And another thing, we found that the cause of, the children die under the 5 years old, like, congenital anomaly, like a neurological defect, something like that. And for the some of diseases, such as pneumonia, diarrhea, or malaria, it still be are the cause for the, the children under 5 years have death, something like this. And in Thailand, compared with the global, I will try to compare a little bit about the situation of the maternity or maternal child and child health in Thailand. And maybe some person we call like a Siam or Thailand. We are like located in the Southeast Asia, as you know. And in Thailand, there are allowed like, 67 million citizens in our country. Yes. And in our country, about the situation of maternal death, we found that since 2012 and until 2018, the statistics demonstrate that there are like a fluctuate, like an incident for MMR since 18% and fluctuate during 20%. As you know that, I think everyone know about the definition of the maternal mortality ratio, or MMR. Is defined as the number of maternal death during a given time period per 100,000 libels during the same time period. That is I show a little bit for the definition of MMR. And after that, the situation in Thailand about the MMR in year of 20s and 20, we found that the incident presents around 29% of MMR. And another thing, we found that the situation or the incident of the infant mortality rate in Thailand in 20 and 2012 was presents around 6.8 deaths per 1,000 libels. That declined around 3.0 from 2021. And for the infant mortality rate in 2021 was around 7.1 deaths per 100 libels. And that is the situation in Thailand. And the interesting part is we can identify the cause of the maternal death in Thailand. The all deaths, I mean the death during pregnancy period, childbirth period, and also puerperiod or postpartum period. We found that for maternal death, we can define like a cause in many of the, many part. The first one we call like a direct maternal death. For direct maternal death, there are many, factors that related to maternal death. The first one is the abortive outcome or abortion. Another one is hypertensive disorder. The third one is the obstetric hemorrhage, including antepartum hemorrhage and also interpartum hemorrhage, such as like abruptio placenta, placenta previa, something like that. And also the cause that result from the pregnancy-related infection, as I mentioned before this, such as the polioamnionitis is the one cause of maternal death. And other obstetric complication we can find like a direct maternal death. And for indirect maternal death, we will find like a non-obstetric complication. I will demonstrate you later. And another cause we found that some cause of maternal death is maybe result from unknown factor or undetermined factor, something like that. And the last one, after this, is mainly result from the coincidental, for example, the accident, something like that. Yet for the classification of cause of maternal death in Thailand, for the ICD-MM or International Classification of Disease and Maternal Mortality, we grouping like the cause of maternal death in 9 defined group, as I demonstrate you in the PowerPoint. First one about the pregnancy with abortive outcome. From the group 1 until the 6, we call like a direct cause, and 7 is the indirect cause. And most of maternal, mostly of the maternal death is come from the direct cause, allow, like 50 or 60%, something like that. From the direct cause, that we know that it can be preventable. That is interesting and is the challenge point for midwifery. Yes, in Thailand, in order to make every, midwifery, especially for healthcare, system understanding how to prevent and how to define the cause of maternal death, we identify the detail, the detail of the group name of the grouping of the classification of the maternal cause. For example, the first one, the pregnancy with abortive outcome. For example, ectopic pregnancy, something like this. The hypertensive, there are many types of hypertensive disorder, such as PIH, eclampsia, and gestational hypertension, something like that. It is like we call the outer manual, something like this. Yes, not only for the, maternity situation in Thailand. Currently, we found that another thing it is, come up and being our challenges is the fertility health situation. If we compare between MMR, it seems like it's still behind. Compare with the fertility rate in Thailand, we will find like the rate of fertility rate keep continuous decreasing. You can see that the last line is the Thailand situation. We will find that currently the fertility rate is around 1.5, and we found that 14% of total birth rate in Thailand we found in the age around 15 and 19 years old. As you know, during this age, it seems like adolescent pregnancy. Yes. And another thing that is important, not only for maternal situation and fertility, we will find that the age structure among the population of Thailand, is like have a big challenge. You can see that between the birth rate and the death rate, something like that. The red line it also it show about the death situation. Currently, we found that compared with the birth and death, it seems like it's half and half, and we can predict in the future it may have like a problem with in our country. The statistic from the literature review represent that currently the proportion among elderly and worker population in Thailand, we will find around one elderly and with the around 4 of worker in 2015, and in 2021 the proportion is changed a little bit among one elder and 3 of worker, and in the future around 10 years after this we will find that the proportion is like a change again. One elderly we will have like only 2 of worker will be the like a caregiver, and the 20 year after this we will find a big challenges for it in Thailand, because we will find that only one elderly will be have only 1.7 worker. The proportion is 1 by 1. Yeah. Why we concern this situation? Because of the age structure has changed. We will come up like a super age society in the year of 2031. After the structure of age change, there are the many of the factor will be changed, and we have to concern not only for the health situation, but we have to concern about the economic social indicator as well. Yes, in Thailand, the health system, we will find that the number of hospitals in Thailand, there are many types of hospital. The first one, for example, the university hospital. There are around 11 and specialized is 61. The totally we have around 1,300 the hospital in Thailand. And compare with the number of the physician per 1,000 people. Currently, we have like around maybe nearly 1 physician with the 1,000 people. Compare with the number of the nurse and midwifery per 1,000 people. We found that currently around one nurse, maybe 3 nurse with the 1,000 people. It means that around like a 1 nurse per 300 people. It is the proportion of the nurse and population in Thailand. It's like the limitation of the nurse and midwifery in Thailand. Yes, again, the literature review demonstrate the data of the medical personnel in Thailand by year of 20 and 20. We will found that currently we have like a professional nurse in Thailand around 176,000 of nurses in Thailand. And we predict that currently we have like a problem of the shortage of not only for the doctor, but also for the nurses and midwifery as well. Currently allow the need of the nurse in Thailand, we need around 333,000 nurse. It means that we have a problem, the shortage around 24,000 nurse in Thailand. It is a big problem for health system in Thailand for now. Yes. And in our system, we found that there are many of key actors that work collaborative, not only for healthcare organizer. We found that for encourage being like a sustainable maternal system, the policymaker is one of the important key actors. For policymaker in Thailand, we have like a Ministry of Health. This organization will be launched many of important policies for all of the healthcare system or healthcare organization in Thailand. And another part, we will have like a maternal and child health board to be act as the key actor for develop the related policy in order to encourage the maternal system in Thailand. And also the Royal Thai College of Obstetricians and Gynecologists will be another key actor for do like a launch of the related policy maker or some parts of the develop like a clinical practice guideline for all of the physician and nurse and midwifery in Thailand. The second key actor is the healthcare organization. In Thailand, there are like two types of the healthcare organization. The first one about like the organization that under the government. We have like a T parts of hospital, the tertiary hospital, secondary hospital, and primary hospital. And another part is the private hospital. Some of the activity we can work together between government and private hospital. And the third of key actor is community. The community is now currently crucial role for the maternity system in Thailand. The important organization under the community, such as the local administrative organization, municipality, social group, and village capital. For example, you may be ever been about the village health volunteer in Thailand. It's one of supporting unit that play like important assistant in healthcare provider, especially for nurse or midwifery in the community. And another key actor is come from the private sector or NGO. Currently in Thailand, for maternity system, we do many activity with the private sector. For example, UNFPA, THAICA, JICA, or UNICEF Thailand, something like that. And the last one about the maternal system, the educational organization is one of the key actors for encourage or support the maternity system. As we know, under the educational organization in Thailand, there are around 50 university that develop like faculty of nursing under the university. There are around the nursing college, maybe around 35 nursing college, and about the 29 private university in Thailand. Yes. The work and activity for support the maternity system in Thailand for policy maker in Thailand, many of, maternity policy or benefit were launched or were developed from the, Ministry of Public Health, and also the maternity laws, maternity leave, health act, maternity indicator or clinical practice guideline are the work and activity in the level of policy maker. For healthcare organization in Thailand, we will find that there are many of maternal and child services. And another thing is for the healthcare organization, the development of the competency in the, healthcare provider workforce, that is another important work and activity. In part of educational organization in Thailand, there are many of nursing curriculum or midwife curriculum, and also about some of maternity training or short course training are developed from the educational organization. And for the work and activity that, launched from the private sector or NGO, there are many of budget of funding that many of healthcare gain or receive from the NGO, such as the, UNFPA or UNICEF. Another thing is many of, support for the maternity system campaign was launched from the NGO. Yeah. And the last one for community level, there are many, work and activity that come from community, such as welfare. In Thailand, some, not only some, many of community can be developed like community-based welfare in order to support the maternal and child in their community, and also some support system such as like emergency services, something like that, or some parts of community can be developed like environment in order to, provide like learning area for the pregnancy women or family, something like that. Or in case of sometime women and family lack of, some budget or some money, the community can be provide like an emergency service in order to help mother and children in the community. Yes, it is the some of example of the work and activity for in the five key actors in Thailand. Yes, in terms of the policy and strategy that related for the maternal and child health in Thailand, we have like milestone for a long time. Since around 1942, the establish of many of public health was established that year, and after that, in many years, we found that we have like many of policies, many of social welfare that's try to develop to support of the maternal and child health system and all of the population in Thailand. Yes, that is just example. And another thing that we concern about the maternals and maternities in Thailand, in the SDG, it's like the optimal goal for the encourage or develop like a system in order to support the maternity. For the SCG that relate to the maternal health is SDG 3, right? That we call this indicator or this target is related to the good health and well-being. This indicator try to encourage or ensure the healthy life and promote well-being in all objects, including the maternal and child health. Yet we have to learn from the indicator as well, because of many policy and many of the human act or any of indicator we have to concern and develop in order to cover the indicator under the SDG. Yes. In Thailand, based on the SDG, we will like, do the health indicator to maternity health. We try to reduce the MMR currently since 1922, we try to, do the many of activity in order to reduce MMR less than 17 per 100,000 live birth. And we try to maintain this indicator until the year of 20 and 26. This is our goal. Yeah. How can we do that? We try to develop some of strategy we call like, maternal death prevention in Thailand. We have like a MCH, Maternal and Child Health Board. Yes. And we do like a maternal death review start in the 20 and 19. We develop like a maternal death surveillance and response system in order to, prevention and reduce the MMR. This, strategy, we develop like a guideline in order to help the healthcare organization in Thailand do the same, standard, right? There are around 6 of, step or 6 of, guideline under the MDSR system in Thailand. The first one, if the MMR was found, that hospital or including government or private hospital should be notified or identify the incident to the, hospital director. And after that, the hospital director should be sends the information to the MCH in the prevention of public health. And after that, this situation or the data should be sent to the MDSR center. And MDSR team will be review and analyze what are the cause and problem of the MMR. And after that, we try to do like provide like a recommendation into the, district level or the hospital who have the incident. And after that, the implementation of the recommendation should be redefined and do like a, summary and sent to the Department of the Health in order to, lens or redesign about the system again. This is our, system for reduce the MMI in Thailand. Based on this, system, we will find that there are many of key actors that work collaborative. The first one, in terms of policymaker, we will find that the Ministry of Health will be the top of the, organization. And after that, we have like a MCH board. And in the administrative, the hospital director will be another key actor and also another board that related to maternal and child health work together. And for practitioner, we will find that midwifery and nurse or physician is the key actor in part of practitioner. That is why midwifery is the play important role for maternal and child health system. Yes, for healthcare structure in public sector in Thailand, we will find that we will provide the care. It depends on, the level of the administrative. For example, in the level of province, the care should be represented at not at least the, secondary care or general hospital. And the functional should be, work with the specialist because in the provincial, there are like a many case that may be have like a complicated or high risk of the patient or high risk of pregnancy. And for district level, the care may be consist of not only primary but also secondary care. The community hospital will be, located in the district level. And for sub-district level in Thailand, we have like a primary care health center in the community level. And for village and family, we have like another healthcare provider that act together with the healthcare. For example, health volunteer, family member, or, traditional healthcare, something like that. Yes, for the maternity benefit in the policy level in Thailand, we try to promote like maternity. We launch our the maternity leave allow 60 days for maternal leave, and we provide like a universal healthcare in all of the native citizen and those who have married with a native citizen. And moreover, we also provide like a paternity leave for like a husband. We try to promote like a father to help mother, and allows maybe 15 days paid for the paternity leave, but only for public sector. And for the private sector, there are some only organization that provide paternity leave. Yes. In the act of private sector, we found that in Thailand, we have like a to work together with the, NGO, for example, UNAPA, something like that, in order to do like a activity to protect our maternity, not only for the, like health situation or health part, but also another part that can be effect to maternal health. For example, like, some cash, some medical benefits, some health insurance, something like that, or also employment protection, something like that. In order to do like maternity care, the activity in Thailand, we will found that we find some, important project that run from the UNFPA. We call like a Safe Birth for All Thailand project. This project have like a key of important intervention. The first one, to improve the national and subnational maternal health surveillance system. And the second one, during the COVID-19 situation, UNFPA, health maternal in Thailand, in order to develop like improve the capacity in the maternal health care in Thailand. And the last one about like promote some like a good practice in Thailand as well. And the project, we have like an important part, some province in Thailand that finished off the project. For example, in Chiang Mai, in Tak, and Mae Hong Son province, this is in the province level. And also for the national level, UNFPA support us to be like do some of the campaign with the Bureau of Reproductive Health and also Bureau of the Health Promotion as well. Yes. Another thing in our faculty, faculty of nursing, we try to, collaborate with the UNFPA. In the last year, we share and discuss some of, project we call like a innovation of the soul safe. This is like a, one important innovation in order to encourage, some of the communicate channel in the vulnerable group, for example, adolescent pregnancy or violent group of teenage pregnancy, something like that. And also some of our activity that work with the NGO or UNFPA in Thailand, we like do like some of the project or curriculum that do with the support of Lao, PDR, and Bhutan in order to encourage that a country to learn about the midwifery competency development, something like that. Yes, for healthcare services in Thailand, I just show you some example. There are, long time ago, we learn by evidence and adjust based on the, context. Some of the activity we found that since around 2002, we developed like the universal health coverage in order to increase the accessibility and equality of the health service for all of the pregnancy. And after that, around 1985, we developed like this manual we call like a MCH book or pink book. in order to provide to the all of pregnancy, like, antenatal care manual, something like that. And in 1992, we developed like the policy that integrated with the WHO and UNICEF. We call the Baby Friendly Hospital Initiative. This policy try to promote and develop many of activities for public and also private hospital to, do some project in order to prevent of MMR and also encourage the maternity health and child care. Yes, and after that, around 1994, we found the, incident about the thalassemia. So that year, we developed like a system of thalassemia screening. Yes. And after that, we try to, promote like a safe motherhood project based on the WHO recommendation. Yes. And allows 10 years before it, since 2010, 2012, in our country, implement the new ANC guideline for low-risk pregnancy that recommend about 5 ANC visits in case of low-risk pregnancy. Yet, and after that, moreover, some of the benefit package was contribute to maternal and child health, not only for the pre-conception period. We try to continue the service and since antepartum, interpartum, and also postpartum period. Yet the detail I will demonstrate again. Yes, and this slide show the newest guideline in our country for all of pregnancy women. For ANC visits among pregnant women, we try to promote them, all of them visits allow 8 time for ANC visit. Under the 8 time, we will decide, the periods of gestational age for third semester. We try to promote them for early ANC visits before 12 weeks in order to do like a physical examination, psychological assessment, prenatal counseling, like ultrasound, and GDM screening in case of high risk, who have the high risk for GDM. And after that, during the second semester, we will encourage them to visit at least 2 times. And for third semester, allow 5 times. Yes, this is the new guideline of ANC visit in Thailand. Yes, and for the system in Thailand in maternity, not only for antenatal care period, we try to provide the care in order to reduce MMR. Based on the literature review in part of prevention, we will start many of services. The first one, we do like a family planning or prenatal service. And the second one, we try to promote, like I mentioned before it, early ANC visits before 12 weeks in order to do like a health screening or do like a physical assessment. And another important thing, why we encourage them to visit before 12 weeks in order to receive like a folic acid for reduce the neural tube defect problem. Yes, and for risk screening in Thailand, we will screen like a VDRL, hepatitis B, HIV, GDM, CVCUA, ultrasound, and also about the dental screening as well. And the newest, the one of come up from the evidence based on the cause of maternal death result from PIS. So we develop the service provide like a low dose aspirin in order to prevent about the pregnancy IS, something like that. And for diagnosis, we provide many of services, for example, OGDT, ultrasound, PCR, or some part of medical procedure such as cervical length measurement, something like that. And in case of high risk, the pregnancy that should be, gained from specific treatment, we provide not only for medical treatment, some part of, services will be applied in non-pharmacological treatment and also traditional medicine. And some case that should be keep monitoring, we will provide like a service of home visits that, collaborate with the community such as with the health volunteer. And we learn the concept of continuing care from the hospital, keep continue us to the, community. Yes. And
Excuse
currently,
me, Achan Nitaya, your time.
the time,
Yeah.
yes.
For
Okay.
4 minutes left. I'm sorry.
Okay.
Yeah.
2 minutes left, right?
Yeah. 4 minutes left.
Okay. 4 minutes. Okay.
Yeah.
This is like the example of the maternity care in Thailand. Yeah, that is the sum of evidence utilization. We try to apply the evidence-based practice in order to do like a maternity system, for example, like a aspirin, low dose of aspirin, something like that. And for the, I think the detail of the care in Thailand, you can find that I maybe mentioned before this, like prenatal care in Thailand. That there are many of services that we try to provide to the, pregnancy. And as well for the childbirth, not only for, hospital delivery, in terms of, some intervention or some procedure, we still apply for the, together with the traditional medicine. For example, for traditional birth attendant, some of community still be do a home birth or have like a birth center. So we have to promote, train them with the skill birth attendant, something like that. Yes, I try to, skip some slide. I see you can learn. And another thing that I would like to share a little bit. I think everyone will be, familiar with the AI and technology. So in past of, maternity system in Thailand, we try to learn and review the, some of new of evidence or intervention, yes, that apply in our maternity. And it is some of, the result from my research from PhD. We do the qualitative study in order to learn about the content of the master system and, and master healthcare system from the community. This is the one of the model that we can gain from the qualitative study we call ethnography. We see the news of model with the community system in order to support maternity in Thailand. Yes, I think for another part, it seems like I try to show you a little bit about, our faculty for do the, the midwifery. I think the curriculum should be the fundamental concept. So in our faculty, there are many of, curriculum try to develop the midwifery to be like a registered nurse and to be like a key actor in terms of maternity system. Yes, I think that is the one of example. Yes. Okay, that is all of my presentation today. Yeah. Thank you so much. Yes.
Okay, thank you very much for Achan Nitaya. Please give applause to her. Okay. Okay, thank you for your wonderful presentation, Achan Nitaya. We will learn about maternal development in global and Thailand, and also maternal system, midwifery education in Thai, and also in Faculty of Nursing, Khon Kaen University, Thailand. All right, ladies and gentlemen, I would like to inform to Achan Nitaya, because your time is you have a limited time, so for this discussion only 5 minutes. Is it okay, Achan Nitaya? Okay.
Yes.
Okay. So could you please for the committee show the question from Zoom meeting chat? Is there any question for the participants?
You can show your face or put it. Oh my, I just see your, masses about my camera. So sorry about my camera. Yeah.
Because your face is not fully in the camera. Could you move your camera? Yes. You're very beautiful,
sorry,
Achan.
okay.
It's okay. Okay, please, is there any question from Zoom meeting chat? Yeah. Okay, could you please show the question from the participant?
Some similarity with how Thailand and Indonesia conduct their maternal care. So is there any breakout or newer trend online in midwives or maternal care in Thailand? Your position? Yes, okay.
Yes, you
I
can
think
answer directly, Achan.
yeah,
Yes.
the one question, the newest trend alive. I think as we know that in the situations of maternity in Thailand, I think the problem is more like complexity and also based on because of the digital like transformation or disruption. The midwifery and in Thailand, we have to, learn more about how to, apply or utilization the evidence-based practice and also like digital into the maternity care system, especially in our education. We have to like to learn and like open mind because of the more complex of the problem and also more complex of the utilization of the evidence base as well. Yes, that is my opinion.
All right, thank you, Achan Nitaya, for your opinion about the question from Rashid Zaki. Yeah. Is there any question again from Zoom meeting? Okay, Achan Nitaya, I would like to ask with you. You were mentioned before that there is traditional caregiver, maybe a traditional healthcare provider at the village. Could you explain to us about what is their role when they take care of the patient, like pregnant woman or child healthcare in the village? Could you explain to us about that?
Thank you so much. In the part for the traditional, like intervention in some of community, we have like some of older people we call expert. In the past, most of them know like a skill for do like delivery or to provide the pregnancy care. But now we have to learn with them and encourage them to join with the some of special course of training in order to learn some of important skill. For example, safety of do the normal delivery. But for the low of them, just only in low risk for pregnancy care. But for high risk, we have to educate them. You have to send to the healthcare system, something like that. Yes.
Alright, Achan, maybe it's him with Indonesia. We call dukun, yeah. Dukun berana. Yeah, dukun berana.
In the south, we call Toby there. Yes.
Yes, for baby care, baby labor. And how about complementary therapy, Achan? Do you have any opinion about complementary therapy for mother or children in Thailand?
Yeah, I think for complementary in Thailand, now we have like many of, evidence and many of intervention for community. That in Thailand, the medical procedure and community have to be integrated together because of commentary is come up with the like attitude and some of the belief we have to like apply in order to integrate with the medical model together, something like that.
Okay, thank you, Achan. So collaborate with.
It's difficult to reject the complementary. We have to integrate.
Like get license, yeah, Achan, yeah.
Yes.
Okay, thank you very much, Achan, for your answer or response to our participant that asked to you. And I would like to conclude that Achan Nitaya present to us before. 95% of all maternal death occur in low and lower middle income countries, yeah, such as like Indonesia or Thailand, and also about maternal death, majority by direct maternal death like abortion or severe bleeding, and also about for children caused by complications related with preterm birth. And in Thailand, the maternal mortality rate 20.3 in 2019 based on the data from the Department of Health Thailand. And for the infant mortality rate in Thailand was 6.8 death per 1,000 live births. And to solve the problem, Thailand was the maternity system that correlated each other. So they have their policy maker from Ministry of Health and etc., healthcare organization, educational organization, private sector, and also community. The target of MMR in Thailand 2024 less than 17%, 17 per 100,000 per live births, and in the next year also 17%. Okay, Achan, this is the end of our topic discussion today. Thank you very much for your participation, as a speaker in this international webinar, the first UNICARE, Unjaya, collaborate with pharmacies, midwifery, and also nursing. And thank you for all the participants that participate in this conference international, the participants from Netherlands, Thailand, United States, Nigeria, Kenya, Taiwan, and especially for our beloved participants from Indonesia. I am, as the moderator, would like to say apologies if there is any mistakes in this program and that like my behavior or say anything about this webinar as moderator. Thank you very much again for Achan Nitaya. Keep healthy and success for you. And for participant, stay in this Zoom meeting. And for Miss Rosita, as the master of ceremony today, the time is yours. Thank you.
Thank you so much.
Thank you, Mr. Suwarno, for bringing us to a very productive session today. Ladies and gentlemen, on behalf of the committee, we would like to say thank you for your active participation today. We have to remind you that the second day of this conference will be start tomorrow at 8 a.m. I am Rosita Dewinda. I would like to excuse myself now and have a great rest of your day.
Recording stopped.